na kushauri we, usiwe na mashaka, niye mwenzio mwana mama, mina songa mbele na kushauri we, usiwe na mashaka, niye mwenzio mwana mama, mina songa mbele na kushauri we, usiwe na mashaka, niye mwenzio mwana mama, mina songa mbele na kushauri we, usiwe na mashaka, niye mwenzio mwana mama, mina songa mbele na kushauri we, usiwe na mashaka, niye mwenzio mwana mama, mina songa mbele na kushauri.
Na kushauri wewe, usiwe na mashaka, ya mwenzio mwana mama, inasonga mbele. Na kushauri wewe, imeshika, usiwe na mashaka, ya mwenzio mwana mama, inasonga mbele. Na kushauri wewe, usiwe na mashaka, ya mwenzio mwana.
Asanteni sana. Mabibi na mabwana, naomba kwa heshima na adhima tafadhali tuweze kusimama kumkaribisha Mheshimiwa Gavana wetu wa Vihiga, Daktari Wilbur Otichilo. Wapi makofi ya gavana wetu tafadhali? Asante sana. Karibu sana Your Excellency. Anakaribishwa na maafisa wake na vilevile ameandamana na naibu wake Mheshimiwa Wilberforce Kitiezo. Wapi makofi ya naibu gavana tafadhali? Karibuni sana katika hafla hii inayofanyika katika wadi hii ya Wodanga, katika idara ya masuala ya kijinsia. Asanteni sana, karibuni sana. Na wana mitambo, mtuandalie wimbo wa taifa na wimbo wa mataifa ya Afrika Mashariki. Na vilevile katika hafla hii toa shukrani za dhati kwa washirika wetu ambao wamefanikisha siku hii ya leo. Bila kupoteza wakati, Samson Indangasi pia songea hapa, utatufungulia kwa maombi. Na tukiwa tumesimama hivyo, tupate wimbo wa taifa na wimbo wa mataifa ya Afrika Mashariki. Karibu ndugu Samson.
Asante gavana wetu mpendwa na ofisi yako yote ya Vihiga County, washiriki wote na wale wamekuja wa mashirika mbalimbali, na mniruhusu mpate kwa salamia mchana wa leo. Bwana asifiwe. Bwana asifiwe. Tuamini tuombe. Baba Mwenyezi Mungu, Baba uliye mtakatifu, ni asubuhi njema Mfalme twaja kwako tukisema ni asante. Baba yangu, hakika tangia mwaka huu uanze umekuwa pamoja nasi. Ijapokuwa katikati yetu Baba yangu tuna wale walioko na majanga na magonjwa na shida mbalimbali, lakini kwa sababu ya rehema zako na utukufu wako Baba yangu tunaomba kwamba upate kuturehemu. Tazama siku hii Mfalme imeandaliwa kwa sababu moja tu, kuja kuzindua zahanati yetu ya gender based violence. Baba yangu, najua kwamba gavana wetu na viongozi wengine wamejiandaa kuja kuifungua rasmi. Ni baraka zangu, ni maombi yangu kwamba Mfalme upate kubariki, kuwalinda, kwa hifadhi, maana wewe ni Mungu. Na kwa njia moja wale wamedhulumiwa Mfalme, Baba yangu naomba kwamba wapatie moyo wa ndani, wapate kupata utulivu, maana wewe ni Mungu wetu. Janga hili Mfalme utusaidie, tu Roho Mtakatifu atusaidie, tupate kuondoka katika kaunti yetu. Mkutano huu anza pamoja nasi, enenda pamoja nasi, na nikupenda Yesu Kristo naomba nikiamini. Amen. Asante.
Naomba tuketi tafadhali. Shall we sit please? Mabibi na mabwana, karibuni katika hafla hii pale ambapo leo hii tunashirikiana, tunakuja pamoja kuweza kuhakikisha kwamba tunamaliza dhulma za kijinsia. Hebu pea mwenzako high five, mwambie end GBV. Sijasikia. Pige kofi. Mpe high five, mwambie end GBV. Asante. Na nafurahi manake Your Excellency, nafurahi manake jana katika hafla iliyofanyika pale municipal, pia sisi wanaume tunaumia. Tunafanya nini? Na tukikuja hapa sote hivi tunajua kwamba basi pia sisi tutasaidika papo hapo. Na shukrani za dhati kwa idara ya masuala ya kijinsia Your Excellency inayoongozwa na mama chapakazi Daktari Ruth Agesa pamoja na afisa mkuu Sylvester Skane, ambao pia wamesaidia katika kuona kwamba tunafika hapa. And Your Excellency, with profound humility, allow me to recognize our partners who have really worked with us, who have offered immense support towards this day. Tafadhali tupigieni partners wetu makofi tafadhali. Maana ukiangalia kando yetu kuna mabango ambayo yanaashiria washirika mbalimbali ambao mwana kwamba tunafanikisha siku hii ya leo. Na napoita Chango watupatie burudani. Chango kwaya wako. Haya basi, wacha nimuite binti Jesse anapokuja. Naomba niwaarifu kwamba pia tuko live katika mitandao yetu ya kijamii. Tunapeperusha hafla hii moja kwa moja mubashara katika mitandao yetu ya kijamii, Facebook County Government of Vihiga, pia ule wa Mheshimiwa Gavana Wilbur Otichilo, ule wa naibu gavana Wilberforce Kitiezo, ili kuona kwamba wale ambao hawako hapa wanapata kujua yanayojiri. JC, naomba tafadhali uje utupatie burudani, na nashukuru sana wale ambao wanatufanyia utafsiri wa lugha ya ishara, Nicholas Jumba aliyesimama kando yangu na Hana Gloria. Karibu JC.
Kuna jisiwa na kuna jisini kama kawaida. Kotini ukienda weke siku solviwa ni shida. The perpetrator kuachiliwa, tasema nini dada? Brown envelope, ndani yake ni rushwa. Minalia, nalia. Ladies and gentlemen, this is JC Kenya aka the Rumba Girl. Menijua kama Rumba Girl from the beginning, but today as I stand here, I'm also a community advocate. I own a CBO called Mudezi and the Community. And this song that I'm going to perform to you is from my heart because it's an experience. I've had cases of GBV going to courts, but there's not been justice to be served. So nataka ukisikia hii wimbo usikie yale maneno yako ndani, as much as it is entertainment, but get the message, okay? Hello? Tumesikia, si ndio? Kwa hivyo nikilia pia mnanisaidia kulia, si ndio? Haya, DJ twende.
JC Kenya. Kile kinachonipa wasiwasi, watu walokuwa ni wazazi hivi leo wamenipa simanzi. Kile kinachonipa wasiwasi, watu walokuwa ni wazazi wametupa kisogo, wamekoma kuwashauri wana wao, wamezizika zile wosia za kwao. Vijana wetu hawana lao, miadarati kubaki familia zao. Mimba za mapema zimekithiri mipaka, kila kona watoto wetu wanabakwa, walio kwa ndoa wanapeana talaka. Mimba za mapema zimekithiri mipaka, kila kona watoto wetu wanabakwa, walio kwa ndoa wanapeana talaka. Nalia, nalia, JC wenu hapa mie, minalia, naumia, JC wenu hapa mie, minaumia.
Let's end gender-based violence, okay?
Kuna jisi wala kuna jisi ni kama kawaida, kotini ukienda weke siku solviwa ni shida. Depa peteta kuachiliwa, tasema nini dada? Brown envelope, ndani yake ni rushwa. Minalia, JC wenu hapa mie, minalia, naumia, JC wenu hapa mie, minalia. Nalia, JC wenu hapa mie, minalia, naumia, JC wenu hapa mie, minalia. Mimba za mapema zimekithiri mipaka, kila kona watoto wetu wanabakwa, walio kwa ndoa wanapeana talaka. Mimba za mapema zimekithiri mipaka, kila kona watoto wetu wanabakwa, walio kwa ndoa wanapeana talaka. There is the last message on that song, please. Kana kwamba haya mambo hayapo, lakini watoto wanalia, wanawake wanateseka, wanaume pia wamenyamaza kwa maumivu. Ila kituo cha GBV sio cha watu wachache.
Chance for the youth to nurture their talent, and that's how and where JC came from. Sasa tupate burudani kutoka kwa rafiki yangu Mugasu. Unanena kama Mugasu. Ndia hapa sasa. Sasa mama hivi ndio kila mtu akuone. Soma. Tena basi, asante sana.
anyamangana k'omundu balondekana n'omwene wageni waishima n'omwami etuba beto tikilo na nende mulogoli mama amangana gene garakora mumwamanya nembe na watende ndekano mmere gasi n'omundu omulayi kali nawe mukurugezi yano mwana omulayi abantu wagenera abantu bakubwasa kukogenya ekigira abantu bakubwese nozeye mu nyumba mirembe giranora mirembe giranora nozeye mu nyumba mirembe giranora mirembe giranora noza omwanya otukilo nanga getyezo nomukera walanga agesa kalyango wabona abana balayi yokyagira nomuha edala gyeyo kajaraba guli tayande nyango wole kali onyala kumushyira arambe aho shyira kali nano kali ikorwa yande wayiza inombera nubyo mwobisi ewobisi yoyo ndagenyanza sana kutangira umwami akaranga manibe nziza mwobisi mumwe abantu babona embora kandi mugenda gwango kigenge walikembora kigira kuzizanigisa nusuye konewo tikilo arandewa mirembe giranora kero wendo mwami otikilo abantu balekora totosendi tomu tomukere tuma amasitawa bayezanga abantu bazizanga banore zisendi z'abasakuru nobe tuwetera abantu bamenye barwana emiryango gibomoka abantu batewana esendi zene zigenda mutakoleka muchunguzanga abantu bamweza girane muha abantu balaba bemuno banore zisendi zene zibazya nakyo batangiriza myando abantu bena bakwa abantu kula bena babanyala okunywa mwana osingi kwa abantu basingira kigira bakona kigira nzeze zane kigira watenda bana na yakutumira bulinyo na mwana omulayi kaliwanga mabisi kaliwanga ajaya muhetero mwigiza abantu makandi nambolere umwanya otikilo nzango bonende wabeko korerera wodi administrator azase ngombe yayanza wadede abantu abatuliyane nembero umwami mabisi banyoranga umudoka kwa serikali abantu wabodi administrator bagenda abanda kubirenge zare narekini onore nasako kubulamu nuba nondo umudoka ili newaza gwango babura kunina matatula kajinemba nyoka liwamba kudiki kali umwami kane
sasa hii kamera ya mizigo ime
omukera agesa kuri shamboya abantu wahenga noda omukera be mukawundi omukera waranga ruji agesa mamebe omurahe oyo mwero omurahe wahenga omurahe ata abantu bo bahigasi kali bacheriza kwabantu mukore gwango nyanuliho watenda balizidisa omwena mana yandere kintu kikyo musimu namwena amayisimu watenda bigarana galiketiyazo takwemerawo tikilona imbere nawandi wose manyeketiyazo nomuyaye tumunane kiulwana yamarongo look at that. No. Mukoroga gwangu tena bantu nobe na training on that. Banga mabisi banga tiaya. Ngelebwa kibona ni chimbura. Yakura pole. Yakura. Naona watu ni la kumu. makano tikilongo wonda aikipa wachari kindatanga karachino no wona watendo leta amasini gendo wambeke ku nane mbange nango tulize kodu yembo wali ulitayo laka uliza yembo ulize kodu shika yangu mgasi bila sikote kwa simu asante sana watu makofi ya mgasi haya basi bila kupoteza wakati naona pia tuko na Madam County Commissioner kuonyesha serikali ya kaunti inashirikiana vizuri na ile ya kiserikali katika kuangamiza dhulma za kijinsia. Kwa sasa basi naomba nimkaribishe ndugu yangu Yate aweze kuendeleza ratiba iliyosalia na kutufungulia ukurasa wa hotuba. Jina langu ni Victor Wetende, naibu mkurugenzi wa mawasiliano wa serikali ya kaunti ya Vihiga. Asante.
Shukrani kabisa mwenzangu Victor Wetende, mkurugenzi wa mawasiliano katika gatuzi la Vihiga. Gavana wetu mpendwa Wilbur Tichilo, naibu wako, mawaziri, county commissioner wetu, waheshimiwa kutoka county assembly, partners wetu, mabibi na mabwana, hamjambo. Hebu tusalimiane kwa hewa, leo siku nzuri. Hamjambo. Kwa majina naitwa Yata Liongo, nikiwa sub county administrator hapa Sabatia. Nitakuwa mfupi wa maneno. Kwanza kabisa tuko kwa boma la kanisa. Ningependa nimuite pastor wetu Indangasi ambaye ni assistant general superintendent aweze kutukaribisha kirasmi katika boma hili. Natumai pengine yuko na shughuli kidogo. Nitaenda kwa haraka sana. Ningependa kuwatambulisha pia wale ambao tunafanya nao kazi ambao ni administrators wa gatuzi la Vihiga. Kwa haraka upesi, jongeni mbele ili mkuje tu mfanye introduction ili pia watu wajue. Karibuni. Asante sana, karibu pastor, tukaribishe kirasmi.
Asante. Gavana wetu Tichilo sana, karibu sana Wakoli. Hiki ni kiwanja cha Wakoli Unlimited Friends Church. Na tumewakaribisha kwa sababu sisi ni watu wenu na pia nyinyi watu wetu. Nasema wote karibuni sana kwa sababu kilaka wetu yuko safarini, mlinzi wetu wa karibu wa kilaka wetu wa JSS Tagala yuko kwa safari kwa Nairobi na hatuna wengine wamekuwa kwenda kazi hapa na pale. Lakini kwa niaba yao kwa jumla kwa kanisa la Marafiki Friends Church Wakoli Unlimited nasema nyote karibu na karibu sana. Mjisikie mko nyumbani. Asante. Asante ni Ndangasi, mchungaji mkuu wa Friends Church Wakoli. Asante.
Asante sana pastor kutukaribisha kwa boma yako. Next year administrators.
Your Excellency Governor, I greet you in the name of Jesus plus the entourage. My name is Monica Odari, admin Chavakari.
Your Excellency, the Governor, the Deputy Governor, I ride on the protocols established. Esther Kengo, Ward Administrator, Yadio Izaba.
Your Excellency, sir, all protocols observed. CV Damaris, West Sabatia Ward Administrator. Thank you, sir.
Your Excellency, sir, my name is David Mwenesi, Ward Administrator, North Maragogi Ward. Thank you, sir. Welcome to Ward. Vida Francis, Ward Admin, Ward. Karibu sana Ward. Thank you, sir.
Sir, Anyenda Caroline, Acting Sub-County Administrator, Vihiga Sub-County. Thank you, sir.
Asante sana administrators au administrators wa Sabati Sub-County ambao tunafanya nao kazi. Next ningependa tu kuwatambua service delivery officers ambao tunafanya pia nao kazi. Whenever you are, maybe just wave. Thank you very much. Lason Keberenge, kuja hapa huwa tunafanya na wewe kazi. Najua uko na jambo tu moja kwa ufupi. Then after the liaison officers, HODs Sabatia, be ready.
Mheshimiwa Governor, naibu wa governor, our commissioner, na all protocol observed. Vandu visa batiamba chezi miteso. Mirembe vosi. Mirembe. Kwa hivyo gavana, karibu sana Sabatia. Sabatia tuna mambo mengi, chini tunataka ni maendeleo, na tuko na hakika kwamba wakati gender based violence imekuja huku chini itasaidia watu wetu ambao wamekuwa na changamoto. Thank you so much governor for the good job you are doing. Niko na hakika kwamba tunasoma vizuri. Sigabega jigare. Na sawa gasi, Thank you.
Thank you very much. You're the last son of Sawetu. Your Excellency the Governor, also we have heads of departments in Sabatia sub-county. We have the MOH, Madam Dr. Caro, because GBV also touches on matters of health. It is good if she says something. And kama kuna any other head of departments, devolved government, mkuje.
Thank you very much, Mr. Ayate. Your Excellency the Governor, the Deputy Governors, members of the Executive, Chief Officers, and all members of the public. Good afternoon. Kwa majina naitwa Caroline Muhati, Sub-County MOH, Sabatia Sub-County. I would like to appreciate the Department of Gender, Youth and Sports for coming up with such an initiative of launching this center. Indeed, it was about time that we had such a center to support the victim of gender-based violence. As a Department of Health, we pledge to work together with their department and offer our support. The sub-county hospital is near here, and we have our clinician who is a focal person who will be able to support those cases whenever they need their help. Thank you very much.
Thank you very much, our MOH. Your Excellency the Governor and County Commissioner, with your permission, unajua pa ground watu tunafanya kazi na SC1 na pia Chief. At that level, I know you'll recognize them at your level, but I just want to recognize you, Mr. Mawere, who is the ACC1 Sabatia.
Thank you, Bwana Admin. To Your Excellency, the Governor, Dr. Otichilo, your Deputy, County Commissioner, CEC members present, and members of the County Assembly, distinguished guests, ladies and gentlemen, good afternoon. I am Mawere Dickens, Assistant County Commissioner 1 for Sabatia, holding brief for the DCC who is away. Mine is to welcome you to Sabatia and to show appreciation, Bwana Governor, for the launch of this rescue center. As the security agencies within the sub-county will work hand in hand and ensure that cases touching on our children and those who are getting violated are handled. I have here the area acting chief, you can just wave, and the children's officer to come for introduction.
All protocols observed. Good afternoon. My name is Mageto Emily. I'm the Children Officer Sabatia. I would like to appreciate our Governor for this activity and the launch. It is a plus to help our children in Sabatia. Thank you.
Thank you, Bwana Governor. Because my boss is here, he will talk on behalf of the national government. Thank you.
Asante sana ACC1 Bwana Mawere. Upande wa utawala tumefikia hapo. Ningependa nichukue fursa hii nimwite mkurugenzi wa idara ya culture ambaye ni Bwana Bongo Ngoseivi. Karibu.
Asante sana Bwana Yate. Your Excellency the Governor, uongozi wote ambao uko hapa kiwemo County Commissioner, partners, waziri wangu na wageni wote waalikwa, hamjambo. Mrembe bosi yangu, Your Excellency, ni mafupi. Kwanza ni kutambua tu departmental staff wako hapa kwa wingi. Penye mko mpungie Governor mkono, wherever you are. Departmental staff wako wapi? Wako hapo, ni wengi sana mno, Your Excellency. Kuna wale, na nilisikia sub-county administrator akitaja sub-county departmental heads. Naona wetu ni kama Your Excellency walisahau wako in charge of sub-counties. Sub-county sports officers penye mko. Simameni penye mko. Penye mko. Wewe unasimamia sub-county na ujui sub-county departmental head ni nani. Number 2, kaeni chini. Sub-county sports officers wako wapi? Youth officers? Sub-county youth officers? Haya, vile sub-county administrator alikuwa anauliza, pia mlisikia, labda ni kizungu ilikuwa mingi sana. Your Excellency, pia kuna wale ambao wanatambulika kama cultural officers wanasimamia sub-counties na disability officers. With your permission, Your Excellency, in less than 2 minutes, allow me to welcome the assistant directors to identify themselves by name. Step forward.
Your Excellency, sir, the leaders that are here today, I'm a happy man. I'm Lisimba Arthur, in charge of gender. Thank you.
Your Excellency, the Governor, the top leadership, esteemed partners, and all who are gathered here today. My name is Adika Leonard, Assistant Director, Culture and Library Services.
Yeah, Your Excellency, the Governor, I ride on established protocol. My name is Greg Ombisi, Assistant Director, Sports. Thank you.
Your Excellency, the Governor, all other guests, my name is Munyora Felix, Assistant Director, Youth Affairs.
Asante sana, Director, Gender Services, National Government. Could she be in? Maybe when she comes, the Chief Officer will recognize her. Mwisho kabisa, mimi, asante. Karibu. Ulikaa mbali sana, Director.
Thank you. Thank you. The County Commissioner, His Excellency the Governor, all protocols observed, good afternoon. My name is Dorothy Murakwa, the County Director Agenda from the National Government. Indeed, this journey started long time ago through the Intergovernmental Gender Sector Working Group. We are very grateful for this noble launch for the Rescue Center. Indeed, we are going to offer a safe space for our survivors. Mine is to call upon all stakeholders who are here. Let us endeavor to create safe spaces in our places of work, in our homes, in our schools, for purposes of safety for all of us. Thank you so much, and God bless you.
Mine is simple, Your Excellency. We know the issue of eradicating gender-based violence is at the heart of this administration. Myself, and riding on the leadership of the department led by Waziri and Chief Officer, we purpose to support all your initiatives to ensure this center is operational and is moving forward in helping and setting the pace in the entire of Western region. Mimi naitwa Bongo Ngoseye, Director in the Department of Gender, Culture, Youth, Sports and Social Services. We were supposed to have 2 panels, and because of the governor's itinerary, we have to collapse it into one and ensure we still deliver and achieve what we intended to deliver today with those panel discussions. Allow me, with a lot of humility, therefore, to invite the Chief Officer for Gender, Culture, Youth, Sports and Social Services to pick up the program.
Thank you. Your Excellency, the Governor, Your Excellency, the Deputy Governor, our CCMs, our honorable members of the County Assembly, our distinguished guests who are our partners, ladies and gentlemen, good morning, good afternoon, sorry. Jina langu ni Sylvester Jisuvei Kane, nikiwa Chief Officer wa masuala ya Gender, Culture, Youth, Sports and Social Services. Ningependa kuwakaribisha siku ya leo kwa hii siku kuu ambayo tuna officially kufungua nyumba yetu, the safe house for our people of Vihiga. Sitaki kwenda kwa mambo mengi. Mimi kazi yangu leo nataka nimkaribishe ambaye anasimamia, kiongozi ambaye anasimamia area hii, atukaribishe hapa rasmi kwa sababu tuko chini yake sasa. ningependa kumkaribisha Mheshimiwa Aziaya ambaye pia atakaribisha wenzake na tukaribisha hapa. Karibu sana Mheshimiwa.
Your Excellency, sir, and all protocol observed, mabibi na mabwana, amjambo. Amjambo. Your Excellency, I have my colleagues that I will want them to come forward. Please, my colleague MCS, come forward. You know, Your Excellency, we are having a session today in the afternoon, and we'll leave a bit early. You know, if this team is missing in the assembly, we will not have a quorum in the assembly. So we will, I will give them microphone so that they can introduce themselves. Just introduction, please.
Thank you in coming. My name is Michael Okoba, MCA Emabungo. Thank you.
Excellency the Governor, Deputy Governor, all the guests available today here. Allow me to say one word, Leader of Minority, on behalf of the wonderful mother who cares for these little angels, Jael. Your Excellency, we thank you for allowing the GBV Center to get P3 forms free of charge at the County Referral Hospital. And Madam Jael has some young ones who are expectant, wako na ujauzito. So nasi yule afisa wa sub-county MOH, Madam Daktari Karo, wale watoto na kuomba Jael akiwaleta hospitali, please give them free treatment. Na Jael ile siku ya kufika kwa watoto kujisaidia ili walete those angels kwetu, wasikuulize kitu chochote. Wakikuuliza nipigie simu, nielekeze department na Mheshimiwa Governor ili uwe na wakati rahisi sana kuwasaidia waweze kujisaidia. So Madam Karo, Daktari Karo, please let us work towards giving them free treatment, and then the department and the Department of Gender will work on a way out to see how we can enroll them for sure, so that they get the best services when they go to visit our sub-county hospital at Sabatia. Thank you so much. My name is Dr. Fred Mavisi, the chair of the Health Committee, MCL Gogamluma Ward. Asante.
Excellency, mimi naitwa David Onjiri, MCL Luanda Township, na ndugu Aziaya ulisema tuseme jina, lakini nataka kusema shukrani kwa Jael, kwa sababu unaposikia wale ambao wako kwake, mimi ni mmoja wa waathiriwa huko Luanda, ambao wale watoto wanatoka kule. Kwa hivyo governor, zama za kale tulikuwa tunasikia story na tunafikiria zinatendeka mbali, lakini zimefika milangoni mwetu. Lazima tuchukue jukumu la kuhakikisha tumelinda hawa watoto. Lakini governor, mimi nataka kusema kwa ofisi ya executive, Mheshimiwa Waziri, wakati tumekuwa na hafla hii, mungehakikisha watu wa area hii, wa eneo hili wako hapa, ili tukisema yale tunasema waeneze hiyo injili, wajue sisi tumekasirika na hayo mambo. Kwa sababu nilipoona watu wakibeba mikono, nimeona baadhi ya watu wenye wako hapa ni sisi viongozi na wale watumishi wa serikali yetu ya county. Kwa hivyo hatutakuwa na wale watatoka hapa na kueneza hii injili. Next time, Madam Waziri, hakikisha ujumbe mapaswa, kwa sababu kitu kama hii vile tuko hapa, labda tungefanyia kule, kwa sababu ni sisi wote tumetoka kule na kuja hapa. Asante sana.
Excellency Governor, Deputy Governor, ladies and gentlemen, good morning, or is it afternoon? Good afternoon. Excellency Governor, let me begin by appreciating you for working hard and bringing partners on board to support the GBV Center. This is something that we have yearned to have in this county, and now it is. Mheshimiwa Njero wale bwangu nyam Governor ulamangana Kambola. Asante. So Excellency, this is something we have yearned to have, and we want to thank God that it is now going to be
it is going to work. Watoto wetu wavulana, watoto wetu wasichana, haya mambo ya GBV sisi miongoni mwetu tunawaongea. Mheshimiwa Njiri, nitakukosoa kidogo. Sisi ambao tumekuja hapa, we are the champions. Wacha sisi twende huko nje tuongee. Kwa maana hata mimi my village Inepanga, ule mama Jael ako na watoto kutoka village yangu wawili. That is my village, that's my home. So I'm affected and we have to seriously talk about it. Hata Mugasu apewe hiyo message wakati anagonga ngoma, anaambia wanaume wacheni kuharibu watoto wadogo. Bakaba bahasi baera, babukura bahasi badzamu kari muno. Mangana kaba no kurabasi bwana batititi, it is not right. Alafu secondly, nomba mborobi. Wanaume tafadhali, kwa nini mnafanya hivyo? No, ukiongea na mtu kama Karo hivi, si tunaweza kuelewana? Tunaongea kama watu wazima. Kwa nini uende mtoto mdogo? Mnasema mnataka ile kitu kuku ambayo ni nyepesi. Kuku nyepesi ya nani? Mtoto mdogo unamuita kuku nyepesi. Ati nyagamenywe kasi nenda mbaa matoro. Manya mdomo bisana. Muanza muachane na hii maneno, tulee watoto wetu ndio viongozi wa kesho. Tungependa watoto wasichana wawe kama sisi. Sisi tuko hapa, we are very proud because hakuna mtu alicheza na sisi. Kwa nini nyinyi mnataka kuharibu? If it's your own child, your own daughter, your sister or maybe your mother, it's not right. Tuache hizi tabia. Na tukitoka hapa tusiwe waoga, administrators, wale champions ambao mko hapa, tuongelee haya maneno. Niko hapa kama Caroline Angote, Vice Chair wa Women Caucus kwa Assembly. My Chair, Madam Gertrude Lumire. Honorable Gertrude Lumire is out of the country. We would be here, all of us. We will have time. And sisi huwa tunaongea haya maneno. So, sio lazima tupate hii platform. Mali popote tunatembea, tunaambia watu muache kuharibu watoto wadogo. Hata tena, mumeenda hatua ingine. Tena you are sodomizing young boys. Why are you doing that? Why are you doing that? Why do you just take somebody's son wa miaka michache unamharibu? What are you thinking while you are doing that act? It is very wrong. We are sad. But thank you, Honorable Excellency, for this center. We are going to support you and follow up on these cases. Thank you.
His Excellency, the Governor, Vihiga County, County Commissioner, wageni wote ambao wamefika, ningependa kuwasalimu hamjambo. Hamjambo tena. Kweli mmechoka mapema. Tusichoke. Your Excellency sir, tuko hapa kwa kazi ambayo ni nzuri, nasi tunakuunga mkono kuona ya kwamba GBV Center imekuwa operational. Sitaki kurudia yale wenzangu wamesema, lakini nataka nirejelee jambo moja tu, a short story yenye nilisema jana, ya kwamba kule Kakamega kuna mwanaume ambaye alinajisi mtoto akiwa 2 years old. Akashikwa, akakaa ndani, akaserve term yake ya 2 years. Akarudi nje kupata huyo mtoto akiwa 4 years, akarudia kitendo hicho. Tena akashikwa, tena akaserve term yake, tena alipofunguliwa akarudia kitendo tena mara 3. Mara hiyo mama ya mtoto alisema, sitaenda kwa polisi tena, mimi mwenyewe nitachukua sheria mkononi. Kile huyu mama alifanya, alipembeleza huyo mwanaume akamwambia, ninaona wewe uko na tamaa nyingi, uko na nguvu nyingi, na mimi ni mwanamke, nataka tuende kufanya tendo la ndoa na wewe. Lakini kabla tufanye, uje nikupikia chakula, tule tushibe. Na akamwekea dawa. Vile huyo mwanaume alikosa nguvu, what happened? Huyu mwanamke alimfunga, akanyofoa zile sehemu zake nyeti, akamwekea kwa mdomo akule, kisha akamkatakata na kumwacha afe barabarani. Now I'm asking, is this where we are headed to? Wanaume mnataka tuwafanye hivyo? Kwa maana tuna uwezo wa kuwapikia chakula, na katika hicho chakula tunaweza kuwekea dawa. Hatutawaacha muendelee kuharibu watoto wetu wadogo, ili hali wanawake ni wengi hata hawana mabwana. Just go look for a grown-up woman and do whatever you want to do with them. Then yesterday somebody said, hata wanaume tunapigwa. Na mimi ninasema, wanaume kama mnapigwa, pigeni nduru. Mtu aje hapa atuambie mke wake anamtandika viboko, nasi tuone tuchukue sheria. tuende kuchukua serikali tuwaambie huyu mwanamke ni mbaya anapiga bwana yake, lakini utakuwa umesema sababu zenye zinafanya mke wako kukuchapa. Ama pengine wewe pia unakusagusa watoto wadogo. Unajua if you are my husband na unakusa watoto wadogo nitakuchapa. Sitakuacha. Mbarikiwe na hayo. Mimi ninaitwa Gladys Yalwala, nikiwa MCA wa Chavakali, mahali pa wanawake. Kujeni Chavakali mtafute wanawake. Thank you.
Your Excellencies, County Commissioner, mabibi na mabwana, nataka niwasalimie. Bwana Yesu asifiwe. Jina langu ni Florence Kegode, nikiwa mwakilishi wadi ya Busali. Nataka tu niseme jambo moja, ya kwamba kitambo tulikuwa tunasema wamama ndio wanadhulumiwa. Sasa hawa wanaume wametoka kwa wamama, wanadhulumu watoto. Wewe kama uko hapa na wewe ni mwanamke, kuwa ambassador mzuri kwa hii county. Ukiona jambo kama hilo, fikisha ripoti haraka. Na hawa waadhiriwa wakati ambapo watakuwa wanaenda kwa hiyo center, tungependa kujua ya kwamba watakuwa wanachukua hapo muda gani, kwa sababu unajua pale mwanaume anaweza enda pale na mwanamke apelekwe pale, upate tena nyumba nyingine imejengwa pale. Kwa hivyo tungependa county government tafadhali tukaweze kuweka mikakati ya kujua ya kwamba waadhiriwa wanapofika pale washughulikiwe na wakaweze kurudi mahali wanafaa kurudi. Jambo la mwisho, nataka nichukue fursa hii kuwaomba wakaaji wote wa Vihiga County. IEBC ilianza registration jana. Tuchukue vijana wetu, tuongeleshe vijana wetu waende wachukue kura, ili wakati ambapo utafika wa kupiga kura wakaweze kuwa na silaha mkononi. Asanteni sana, mbarikiwe.
Your Excellency Governor, Deputy Governor, County Commissioner, Waziris, Shofco, all partners, ward administrators, hamjambo? Hamjambo. Kwa majina naitwa Mheshimiwa Helen. Tumefurahia governor kutuletea hii senda, because vijana wetu mara nyingi because ya mambo ya kutumia miandarati inafanya wanakosa kujua wanafanya nini. Na watoto wetu vijana sisi tunawapenda. Miaka ikifika ya kupata mtu pata. Kama unaweza jilinda, jilinde. Na kama uwezi, unakula ugali, unakunywa chai, sasa matokeo ya usiku itatokea wapi? Sasa vijana wetu, mkuwe watu wa kujua hawa ni wamama wetu, hawa ni wasichana wetu wadogo. Ukitaka mtu unaenda kwa senje, unamwambia senje, leo nimefika umri wa kwenda wapi? Kupata mtu. Si senje atakutafutia mtu. Kuliko kujifanya unajilinda na uwezi jilinda vizuri, utasumbuliwa usiku alafu unaangukia kwa mambo mabaya. Asanteni sana. Kwa majina naitwa Mheshimiwa Helen Mwanika, nominated MCA Vihiga County.
Governor wetu, all protocol observed. Na wageni tusalimiane. Bwana Yesu asifiwe. God is good all the time. Kwa jina mkanite Rita Atieno, Vihiga County. Mimi langu ni kushukuru. Wa kwanza tunashukuru mama wetu county, Honorable Dagala, aliyeanzisha, aliona future, akaona ya kwamba watoto wetu ama wamama wetu wa Vihiga County wanasumbukana, akatujengea hilo jumba. Pia tushukuru gavana wetu, alipopewa hilo jumba, ametafuta watu wa kumsaidia ndiposa tuendelee. Jana mimi niliongea wenye tulikuwa, na niliuliza tu wa mama jambo moja. Tunasema end GBV, isn't it? Tuta end aje? Kwanza sisi pia tunachangia. Kila siku kubeba mzigo, tunaenda matanga, tunawacha wasichana kwa nyumba na baba zetu. Kila siku tunawacha watoto, tunawatuma kwa maduka usiku. Ukienda huko Luanda unakuta watoto wachanga, mama amekaa kwa nyumba na mtoto amempea mzigo, anaenda kuuza vyakula barabarani. Utaona mtoto amebeba mboga saa moja, anaingia kwa den hivi hivi. Unafikiria nini kitatokea? Kwa hivyo tukitaka Vihiga yetu ama kaunti yetu iwe safi, tafadhali wa mama tuchukue jukumu. La mwisho, tunajua wababa huwa wanapigwa, we are being battered too. Tafadhali sumpige nduru. Tunajua ni culture, mwanamume si rahisi kupiga nduru, lakini tafadhali tupige nduru, tumsaidie. Juu sisi wa mama wengine tumejifanya
tuna senti tunawapiga. Kwa hivyo naomba tu gavana, ni asante kuleta hili jambo, ndiposa hata hao baba wetu nao tuwasaidie. Na pia bangi kwa mapolisi, nilisema bangi wanauza, ukiulizwa unasema ni alikuwa amevuta bangi ndiposa akafanya hicho kitendo. Mapolisi nao tukipeleka hao wanawaachilia. Mnataka aje? Mbarikiwe.
His Excellency the Governor Dr. Wilba Otichilo, all guests invited, ladies and gentlemen, good afternoon. My name is Janet Fundi, a nominated MCA. Mine is just to remind everyone that initially we used to have morals and culture. I think we need to go back to that. I'm a member of the committee, Department of Gender and Sports, where the function we are having today is domiciled, and I'll just request the department to be keen when they are doing their budgets, because whatever we are talking here cannot be done without a proper budget. So Director, Waziri and Chief, sometimes you bring a budget to the county assembly without allocation for such an organization. So like, I'll give an example, the budget we had passed previously, I didn't see any allocation of the center. So that is something you need to take note on. I want to take this opportunity also to give thanks to our partners who are very ready to assist us. Much thanks to our governor, His Excellency. I want to say that you are doing a good job. It's a milestone. Having this center with us is a big step. And all of us in Vihiga, we are either affected or we are players. Let's all go out and do what we are supposed to do concerning the GBV and the center. Watu wenye wako karibu na hiyo center, we want to, Honorable Tiaya, I think it's your area, be a leader, a good leader, a good communicator, make sure the GBV is well taken care of. And the people who will be there, department, if there are any regulations and rules pending that can make the GBV function, kindly bring to our attention. Thank you.
Your Excellency the Governor, Deputy Governor, na watu wa Vihiga Mrembe Kandi, Your Excellency, wakati Mheshimiwa Gladys alikuwa anaongea hapa, I also took a lesson, kwa sababu mimi napenda kula, lazima nitakuwa careful ile kitu nakula. Lakini wamama tafadhali, tusikate pia engine. Hii engine ukikata, gari pia itakosa kufanya kazi, na sisi wote tunahitaji. We need one another. The car also needs the engine to continue running. Your Excellency, one thing I have to say, ni kwamba ile GBV Center I've had an opportunity kwenda pale. Na mimi ningependa kuomba department, tuko na dining hall ambayo imestall pale, fast track that process so that that dining hall is completed, na tuko na a fully operational dining hall ya kusaidia wale victims. Vile vile mimi ningependa kuomba tukue na ile sustainable funding kwa wale watu ambao wako pale waweze kupata usaidizi kwa njia ambayo inafaa, ile GBV center ikuwe a model GBV center katika nchi hii yote, ingawaje hatutaki victims waende pale, lakini tuwe na kitu ambacho kinafanya kazi kwa njia ambayo inafaa. Kwa hayo mengi na machache, Mwenyezi Mungu awabariki.
Asante Your Excellency, nitasema machache. Jambo la kwanza huwa unasema don't forget where you have come from. We are having that GBV center because the woman representative of the county, yeye ndiye alianzisha pale huo mradi. Si lazima tumu appreciate yeye ndiye alileta pale. And in the whole country there were only 7 that were being constructed. Ours being one of them. Now Your Excellency, when they were handing over that GBV center to you, county government, tulikuwa pale na Mheshimiwa Aisha Jumwa. Na wakasema sasa hao wamejenga, they want operationalization of that center be handed over to the county government. And I want to appreciate our partners, Shofco, the Dutch people, and the UNDP, na wengine, for coming in so that we see the operationalization of that center. And Your Excellency, mutu akidhulumiwa, we have 4 people that are involved in making sure that that person gets justice. Mutu wa kwanza ni village elder, ama assistant chief, ama chief. Chief akicollude na wale ambao wamefanya hiyo tendo, huyo mtu hatapata justice. Mtu wa kwanza ni huyo. Mtu wa pili ni polisi. Wakishika mtu ambaye amefanya tendo, amedhulumu mtoto kijana ama mtoto msichana, ama amedhulumu mama ama amedhulumu baba, apeleke kwa polisi, na polisi wachukue hongo wamwachilie. Huyo mtu ambaye amedhulumiwa hatapata justice. Mtu wa tatu ni hospitali. Yule ambaye amedhulumiwa, amekuwa defiled ama amepigwa, akienda hospitalini ajaziwe P3, hospitali wakatae kujaza, ama mwambie leta pesa ndio tujaze, na akose kukuwa na pesa ya kulipa. Alafu mtu wa nne ni court. Courts wakipeleka mtu ambaye amefanya tendo uhalifu. So all those partners are players and make sure that there is justice kwa yule mtu ambaye amedhulumiwa. Na mimi nataka nishukuru sana mahakama of late. Mtu ambaye amepelekwa mbele ya mahakama na amefanya defilement, hata ananyimwa bond ama anawekewa bond ya pesa mingi ili aende kodiaga. Si mnajua hiyo maneno? So we want to appreciate the courts. So we want to tell our chiefs, our police and our hospitals, you pull up your socks so that we continue getting justice. Na nasikia hapa wenzangu wakisema wamama wanadhulumiwa. Hata siku hizi wazee wanadhulumiwa. Mkitaka kujua wazee wanadhulumiwa, juzi tukiangalia kwa ADP wamesema vitu 4 ambazo zime increase katika kaunti hii. Kitu ya kwanza ni gender based violence, ime increase. Kitu ya pili ime increase ni child abuse. Jambo la tatu, kitu ya tatu ambayo ime increase ni incest. Incest ni watu kuzaa kwa watu wa ukoo. Msichana anazaa na ndugu yake, mzee anazaa na msichana yake. That one is on the rise. Jambo la 4, kitu ya 4 ambayo iko on the rise is mental health. Mental health, watu wengi sasa wameanza kuwa na akili ambayo inachanganyikiwa. And we must appreciate that operationalization of this center is going to cure 2: child abuse, GBV and incest. Na tunataka tuambiane ukweli. Wale watu ambao wanafanya matendo hayo, wengi wao huwa wanaepuka mkono kwa sababu tuko na kangaroo courts. Tuko na watu wa jamii wanasema hasa huyu akienda kushtaki baba yake watafanya namna gani, babaka anaweza kufa ndani. Wacha huyo mzee aenda akufe kwa sababu alijua huyu ni mtoto wake. Kwani kabla mzee arepu mtoto si alikuwa anajua ni mtoto wake? Sasa wacha aenda aoze huko kwa sababu alijua this is my daughter na akamfanyia unyama. Na tena siku hizi wamepinduka, wameenda kwa watoto vijana. Na nimesikia hapa mwingine akisema mwanaume ukipigwa uende useme sababu gani umepigwa. Hakuna sababu ya kusema ukipigwa lazima mwanamke tena ashikwe awekwe ndani. Haiwezi kuwa ati mwanaume ukipigwa utoe sababu na mwanamke akipigwa hakuna sababu. Hapana, gender based violence is gender based violence. Komeraba karim madari mubara agira ba komeraba huraba sasa sababu. Si mama ni mangana genaga. Mwanaume ukipigwa sio lazima utoe sababu. Onyesha tu alamu umepigwa, washike huyo bibi yako aende ndani. We cannot say mmoja akipigwa asitoe sababu, mwingine akipigwa atoe sababu. No. Gender based violence is gender based violence. Na Your Excellency the Governor, wanaume wanakufa, hata wengine wanacommit suicide kwa sababu ya kunyanyaswa tena. Na ukiangalia watu ambao wanacommit suicide wengi ni wanaume. Kwa sababu anaogopa akienda kusema amepigwa, hata akienda kushtaki kwa polisi, polisi watamfukuza. Watamwambia wewe ni mwanaume mgani unapigwa na bibi? Sasa mwanaume anaona kuliko niende nikaweze kuwa embarrassed mbele ya polisi, mbele ya chief, wacha nichukue kamba nikajinyonge, ama wacha nikaenda kuanguka kwa maji. So we want to tell our people, let us be one another's keeper. Your Excellency, jambo la mwisho vile mheshimiwa amesema, we have partners ndio, but as a county government let us also play our part. Let us make sure the GBV is operational, it's functional. Ile mjengo ambayo ilianzishwa pale department wamalize. Kama kuna, kwa sababu watu ambao watakuja pale survivors watakuwa wengi. na tuko pale na choo mlango mbili peke yake. We must make sure that we have enough sanitation. Lazima tuanzishe pale tena miradi ambazo wale survivors wakikuja pale hawatakuwa wanakaa kama watoto wa shule. Tuweke pale virehani, tuweke pale tuko na fish ponds pale, tuweke pale samaki, tuweke pale shamba kidogo ya kutengeneza agribusiness na vitu zingine ambazo wale survivors wakienda pale they will be learning something as they continue to recuperate and get healed. For those many remarks, my name is Atia Vincent. I'm the leader of minority in the county assembly. Asanteni.
Thank you. Patieni mheshimiwa makofi mzuri, ameongea vizuri zaidi. Your Excellency, before I spell out the objectives of why we are here today, allow me just to recognize these three powerful ladies. We know them by name. I'm giving a minute. That is Jael, Florence, and Beatrice. Please, we want to know you. They are doing a lot of great work in our communities in terms of GBV issues. Karibuni. Dakika moja tu, please. We have a panel discussion. The panelists are warming up. They have really warmed for long.
All protocol observed. Amjambo. Majina ni Jaela Bukusa, nikiwa mwanaharakati mtetezi wa haki za wanadamu, na leo hii mimi nashukuru. Kwanza nitaanza kumshukuru our women rep kutujengea lile chumba. Cha pili nashukuru governor wetu wa hii county, kwa sababu kama hangechukua initiative ya kupatana na partners ili waweze kuweka kile chumba kianze kazi, tumekuwa na wakati mgumu. Mimi nakaa na watoto, bwana governor anajua. It is so challenging, it is painful. Mmesikia wakisema hapa kuna watoto wajawazito. Ni uchungu unapomwona mtoto wa miaka 14 ako mjamzito na mimba ni ya baba. Baba zetu tulikosea wapi? I'm asking this as you go, ask yourselves, mvua ilianza kutunyeshea wapi? Niko na msichana wa miaka 16, ni mjamzito, mimba ni ya mjomba, ndugu ya mama. It is so painful at times as you sit with those children. I have the smallest child, ako na miaka 4. Alikuwa defined na baba. Surely, even if it means mambo ni mabaya, mujiulize. And before I give out the microphone, we have people we work with in the community. Tajali team, Violet. Kama uko mahali wave, kwa sababu Violet nimefanya naye kazi Rwanda, hati kiasi imefika ya kuwa umekaa utapigiwa simu hata saa 7 ya usiku. Niko na women HRDs, wanamama watetezi, simameni muinue tu mkono. Tuko na survivors. These are the people who work and tell you whatever is happening within the community. Na survivors wako very strong through Mama County. Nakumbuka Mama County akitupa pesa ya empowerment, and it has made these women and men to work together and fight GVB within our own community. I will challenge our MOH staff, tafadhali. And this goes, najua mtu atasikia vibaya, lakini hii lazima niseme kwa sababu mimi upenda ukweli. Our referral hospital, gender in the referral hospital is not being served very well. Mwadhiriwa akienda referral hospital, akianza kutembea kuanzia huko juu, ateremuke aende lab akalishwe, arudishe juu, anapotelea along the way. We need one-stop shop. In fact, we don't need, we are demanding. MCA Mavisi, uko kwa assembly has chair of health. We want a one-stop shop in the referral hospital, and it is urgently needed. Tunahitaji daktari kuwa pale 24 hours. Why? Even the police officers are suffering. Nimekuwa juzi in one of the police stations. Officer anatoka na waadhiriwa anaenda referral hospital. It takes her about 7 hours ndiye akuwe served. Atakuwa ofisa mgani atavumilia hiyo kiasi? It is so painful. 2, mnafungua senda. We need a response vehicle. And it should be there immediately. Kwa sababu mtoto amedhulumiwa ama mama, tunatumia mapikipiki. Sisi wenyewe we are also risking our lives. Whoever is going to do that rescue ana risk her life. Gender, tunahitaji gari. Not even tunahitaji, we are demanding for it. We are taxpayers in this country. We are demanding for it. Finally, na appreciate governor kwa kazi nzuri, na appreciate all the partners. Madam Betty, kongole. UNTP, kongole. Mmetufunza, mmetupea masomo, na hiyo ndio masomo tunatumia. Pamela, uende umwambie mama county tunashukuru, nasi tuache aendelee kutushikilia mkono. Asanti.
Thank you. Just a minute. The program is tight.
All protocol observed, and community at large, Vihiga community, we are glad, we are thankful for the recovery center, because we have been moving around, taking our survivors to Kisumu, Kakamega, Kitale and other places. So thank you, and also recognize my champion. Can you wave wherever you are? CSO Network, Madam Betty, you have been of help. Kenya Police, Gender Desk persons, thank you so much. Ministry of Health and other departments. So we are thankful for the center, and we shall be doing a lot. Let you refer the survivors to the needy places so that they can get the counseling and also get justice for their problem. Welcome. I'm Florence Achuya from Shofco.
Our governor and the deputy governor, all protocol observed. Na wasalimu nyote, hamjambo. Hamjambo tena. GBV champions, hamjambo. Thank you so much. Kwa majina, ninaitwa Beatrice Nora Otuma. I come from Luanda sub-county. I'm a paralegal and a case manager. Maybe wenzangu wameongea mambo mengi yenye ningelisema. Sasa mimi nitasema tu umuhimu wa hiyo nyumba. Haswa sisi maparalegals na case managers wenye tuko nyanjani. Hii nyumba itatusaidia kuweka evidence za survivors. Hii nyumba itatusaidia kuhakikisha survivor wetu wako secure. Kwa sababu tunapopeleka cases kotini, saa zingine zinakaa huko kwa sababu ya kukosa evidence dhabiti ya kutosha, na hata unapata kuna wale wazazi wenye wanatorosha survivors, na unapata kesi haiwezi songa kwa sababu survivor hawezi kuja kotini kutoa ushahidi. Tena ningependa kuwashukuru our development partners, haswa UNDP kwa ile kazi imefanya kupitia kwa madamu wetu advocate Betty Okero. Amefanya kazi nyingi sana hapa Vihiga County. Amefunza case managers, ametrain, and she's able to facilitate hawa watu wakienda field waweze kusimama na survivor na caregiver. Kumalizia, niko hapa na ombi kwa partners. Partners, before we had other partners like Maldini. They trained police gender-based officers and teachers and healthcare workers. All of a sudden, we had massive transfers. The gender officers who were trained from various stations were transferred. Hawako. Wale wenye tuko nao ni wageni. And that's why mnasikia wenzangu wakilia, saa zingine unaweza enda mahali, unafika mahali unapata kukwama kwa sababu lack of knowledge. Partners kindly put more on, invest more in training our personnel. Otherwise, thank you. Hiyo nyumba ilindwe, hiyo nyumba watu wenye wataenda kufanya Thank you. We developed a GBV policy and a children's policy. Because the problem here was Vihiga County could not allocate any funds. We didn't have a policy for the GBV. Now the policies are there. Governor, tunakuomba tafadhali. Wakati wana allocate pesa, let those policies help in the allocation of funding towards the GBV kitty. Thank you so much.
Thank you, thank you. Can we give her a heart clap? Time is moving so fast, and we have our panel discussion that is supposed to start. Actually, it's belated. But allow me, Your Excellency, just to spell out the objective of today. Today, we are here, we are launching the GBV Rescue Center, and the main objective is to operationalize. I want to appreciate Your Excellency. You gave us timelines. We even complained we needed 3 or 4 months to launch the operationalization of this center, but you insisted, you are giving us by September, this center should be operationalized. So we want to appreciate. If it were not for you pushing us to the wall, we would not be here today. We appreciate a lot for the timelines you gave, and we can see we are giving birth to this child. The GBV Rescue Center is going to be a one-stop facility center. As you've heard our beautiful ladies saying they need such a one-stop facility. Operationalization of this center is going to give all these services, the issues you've had our ladies appeal to have. So we are going to have our survivors taken good care of. They are going to get legal support. They are going to get medical support. They are going to get psychological support. And the issue of cases failing in court will not be there, because we are now collaborating with other stakeholders who are going to provide in preparing the right file that will go to court to stand the times of time. So this center is going to help our survivors, and we're going to cure the issues that most of the speakers have been before me have been raising. Today, from today, the center is going to be operational. It's going to be operational. And we are here to bring all stakeholders together so that we can look at the future. After today, so what? We need to sustain this center of ours. And that's why those who have been invited here are the key stakeholders who are going to help us sustain this center that is here. So this is not my day. I just want to appreciate all those who we have worked together to make this day successful. But before I hand over this program to Waziri, I would want to inform Your Excellency that we have deployed staff. And I would wish to see the staff we have deployed to go and manage that center to stand here so that we see them. Director, with your team. All the officers we have deployed to This center, can you step forward? We want to see you. There is the issue of the vehicle. So we are set, Your Excellency. We have a great team. We did not ask to recruit. The Department of Gender has more than enough staff, and we have just deployed them, and they are highly qualified to manage this facility. Lisimba, where are the other officers? I would wish you introduce them.
Thank you, Excellency, sir. I'm Lisimba Arthur, the Director of Gender. Our small staff here, she'll introduce herself, they'll introduce themselves. But apart from this, we also have the cook, we have the security, we have the clerk that will be there, and we'll also be working hand in hand with our MOH that is around Sabatia. Thank you.
Her Excellency and all protocol observed, I'm Elsa Kigei. I've been working with the Children Department, but I've been deployed in the GBV Center as a social worker.
His Excellency and all guests, good afternoon. I'm Josephine Angeo. I've been deployed to the SGBV Center as the case worker.
Thank you. Your Excellency, we have also requested our other department, sister department, we've requested deployment, secondment of staff from the Department of Health, from the Department of Public Service, the enforcement officers, and also we've requested for deployment of security from the national government, the APs, to man the station. Allow me to invite Waziri to take over the program.
Excellency, the Governor, the Deputy Governor, the County Commissioner, all our partners, and all the guests today, good afternoon. Good afternoon once again. I'll not have much to say. Kwa sababu ya muda, ningependa kwanza kuwajulisha kwenyu mawaziri wenzangu ambao wako hapa. Mawaziri, tafadhali.
Mheshimiwa Gavana, pamoja na naibu wako, viongozi wote na wananchi wa Sabati, hamjambo nyote. Mlembe. Mimi naitwa Meshak Mulongo Onzere, nasimamia idara ya fedha na mipango ya uchumi wa kaunti. Kwa hivyo Mheshimiwa Gavana, mimi sitasema zaidi, japo nina furaha zaidi kwa sababu wakati mchakato wa mambo ya hii SGBV ulianza, ulikuwa umenipatia nafasi ya kufanya kazi katika idara ya jinsia, na kwa hivyo nina furaha kwa sababu safari hii ilipoanza nilikuwa hapo, na nina furaha kwa sababu pia umetilia bidii katika hili jambo ambalo lilikuwa kigezo cha wewe kuchaguliwa, because in your manifesto under social protection it was one very specific issue, rescue and rehabilitation center, and I'm grateful you have achieved. If someone was to mark that particular exam, you have achieved an excellence. So thank you so much. May God bless you.
Your Excellency the Governor, the Deputy Governor, the County Commissioner, our partners, na wakaaji wote wa Vihiga, hamjambo. Bwana asifiwe. Leo mimi nina furaha kwa sababu a promise has been delivered. Your Excellency, you promised in your manifesto, you promised the people of Vihiga and you promised us that this will be done and you have delivered that promise. Kwa hivyo sisi wote tunajumuika na wewe na tutaunga mkono kusupport kazi yote itafanyika pale kwa center, na hata kitu yote itahitajika, tuko hapo kutumika kwa minajili ya watu wa Vihiga. Mungu awabariki. Naitwa Joseph Karungani Lunani, nikiwa waziri wenyu wa masuala ya biashara, utalii na mashirika.
Asante sana. Your Excellency, the partners who are here, we also have some officers from the county who didn't stand up, those who work in the governor's office. Kindly just be upstanding and wave to the governor. Thank you so much. Because of time, I will not go into a lot of talking. You've seen on the program, we are even having a part that we were to have a pre-recording. This part, we're not going to have it because of the setup. So I'll go forward to say, one, I'm pleased that this day has come. I'm one of the happiest people because when I took over the department, it was that we were to deliver. And the way Chief has said, we've worked round the clock to make sure that this day is done. I would like to extend my thanks to the partners. I've been talking to the partners time to time, every day, and they have been very good, promising people, and today, even I'm happy they are here with us. I would like to take this time, of course, to recognize the Netherlands, the UNDP, the CIFA, the CSO network, SHOFCO, Access to Medicine platform, Kenny, Vihiga Women in Business, to Ajali, and above all, I recognize the partner who constructed the GBV, that is the NGAF. And I think some of you may not know when how the building came up. His Excellency was asked for land, and Mama County is the one who did the construction. And you saw the construction being handed over to the county. But it could not start being used until many things are put in place. So that's what we've been working on until now, that we are going to make sure that it starts working. I would like to say, why are we having a GBV center? And this one is just to make sure that we are having survivors being fear-free. They are at one-stop shop. Everything will be done at the same center. And we are working together with the police, the judiciary, and health. And we've been very close with the county commissioner on the front line, since I'm chairing with her the county committee. And I can assure you, we are looking forward to making this center operationalize in a better way. After this, we are actually coming up with a model blueprint which we are going to use, at least to give even regulations on mtu akipatikana ataweza kuingia kwa hiyo GBV center namna gani, na atakaa kwa muda gani, the period of staying there, and what is supposed to be done. So I must say, there is a county committee which after this we are sitting, and plus Betty, who has been very instrumental in this. I must thank her so much, because every there is no day that has passed without me talking to Betty, and she's been telling me on what we should do. And I'm sure, because now the Netherlands and the other partners helped in coming up with a policy after that handing over of the building. We're going now to come up with a proper work plan on operationalizing this, and it's going to work. I must extend our thanks to the judiciary. Today, we are not here with the Lady Justice. She talked to me last evening. She just came from out of the country, and she was not able to be with us here today. Lady Justice Jacqueline Kamau, and I also talked to the resident magistrate Jacqueline Angando, and in their absence, they have sent the ODPP who is here with us today, and I'm sure he will be able to give a message on that. So this center is going to operate fully when we are actually working together, the police, the judiciary, the health, and of course the department. And I'm sure we're going to make our people of Vihiga have a proper and guided, safe place. What I would like to say is, those people who are, wale ambao mmedhulumiwa, tafadhali msinyamaze. Come forward. Yesterday tuliongea vizuri, muwe free kuongea na kusema yale ambayo yametokea. And as it has been said, let us put no or an end to GBV. Asanteni sana. And at this moment, my name is Dr. Ruth Agesa. I had forgot to say, I would like to hand over the microphone to the director, Bongo. Thank you.
Asante sana waziri. Makofi kwa waziri. Asante. Your Excellency, as I indicated earlier on, we are going to have a hybrid panel. Initially, we had programmed to have 2 panels because of the itinerary and the weather. We've been able to have a discussion with the lead person of the partners, Betty and Brenda, and we have agreed we are going to have 1 panel. And on this panel, Your Excellency, first is to appreciate all those partners who are to appear on the 2 panels. We shall mention them by name, and I know Waziri will capture that thereafter. Just as they set the venue for the panel discussion, allow me therefore, Your Excellency, to call upon the following partners who are supposed to sit on today's panel. Remember, today's panel has 2 sub-themes. The first is from policy to practice, managing the GBV Center, and then thereafter it is closely integrated with the role of partnership in the design, development and management of the GBV Center. Of course, they will highlight the collaborative partnership model, present a theory of change and share opportunities for sustainability. Allow me to call upon the following: the office Allow me to call upon the Office of the Directorate of Public Prosecution to kindly step forward. There's a gentleman here. If I look at him, Your Excellency, he looks quite very bright. I'm sure I will answer the questions. It would be unfortunate to look bright and nice and you fail to answer the questions. Your Excellency, number 2, we are going to call upon the Department of Health. Department of Health,
and also mental health support, and also our health providers will be able to be in court as expert witnesses. So as health, we are giving a whole comprehensive package for the survivors. Thank you.
Thank you so much for that. And now we'll be moving to Mr. Cosmas. Just from what Ms. Abigail has just talked about, she talked about we'll be having, we'll also have witnesses from the health department going to court and moving there with evidences. I would want you to maybe just tell us briefly, how is the judiciary going to work together with the Gender-Based Violence Recovery Center to ensure that the survivors get justice that they so much want?
Well, thank you. I would say that, first I would say that SGBV cases are very emotive. We have handled these cases since when I've been a prosecutor for over 10 years. And I would say that part of, actually ODPP and judiciary, we almost work hand in hand. And when we have these survivors, most of the time when these cases are reported to the police, they do the investigations, they compile the files, they bring them to the ODPP. The ODPP looks at the files and confirm whether we have all the evidence, and then after that we approve the matter to go to court. Now, there comes a situation where we have the survivors, and most of the time these survivors, either the perpetrator is somebody who comes from the same, home, or is a close relative, and at least we always want that to be brought to attention so that we can even convey it to the court. Now, the reason why we want it to be brought to attention is because we really want to safeguard or secure that survivor so that we can at least make sure she lives in an environment that she can be able to be safe and eventually come to court and testify. As I say, they are very traumatizing, and at most of the time where we have a relative involved, the relative will try as much as possible to interfere with the matter. So in as much as we have these survivors, we always have a file called a PNC, a child in need of care and protection. That is one step that we always advocate when we are having these survivors. And these files to do with child in need of care and protection, the court will try to look at the environment where this child is coming from. And if it does not favor the child, the court will actually make an order for the child to be removed from that environment and be taken to a safer environment. And having a rescue center, that is where we can have such a victim being put in such a place. And we expect also psychosocial support from such places. And when these victims are put there, at least as a prosecutor, I will also make sure that I request the court to have at least an earlier date. Because as you know, some of these survivors are very young children, and they tend also to suffer from memory loss. So if you're likely to have the case dragging for long in court, we are likely to have the evidence, disappearing from the minds of those victims. So we make sure that at least we can have a very early date, we can dispense with the evidence of the victim. And that is one way of actually trying to make sure that the victim gets justice at the trial court. And also, I always tell my investigators that when we're having these matters and there's a lot of interferences, I always advocate victims or the family of the victim to report any threats. When you have a threat, at least I can tell the IO, swear an affidavit to cancel bond terms. That one also pushes now the perpetrator back into the prison. Because as you know, when you're charged, you're still innocent until proven guilty. You are entitled to be given a bond or a bail. So if threats are still going on, we still encourage these people to be put back. We can cancel the bond terms and put these people back. So we are actually advocating for justice for both the victim and also the community, and at least ensuring that we see our girls, grow to be responsible citizens. Thank you.
All right, thank you so much. We've just been joined by two other new members. We'll allow them to introduce themselves before we proceed.
My name is Mageto Emily. I'm the Children Officer, Sabatia.
Thank you so much. It's a pleasure to join you. My name is Sheila Leona. I work for the Institute for Social Accountability. Thank you.
Thank you so much. I think, Ms. Bageto, you just came in at the right time. We were speaking about the safety of the survivors. He spoke widely about that. So I would want to know, how does the safety of the survivor actually determine how the case in court ends? How has your department been working to ensure that the survivors are actually secure? They don't, no matter what happens, the threats that you receive from the families and all those, getting justice for our survivors.
A child who's a survivor?
A child who's a survivor must, number one, have timely reporting. A child who's a survivor must be helped in terms of reporting any matter in terms of SGBV. And one of the measures that we take as a DCS is to ensure that this child is rescued and placed in a place of safety, such as the rescue center. So this child must be taken away from the family if it is necessary, and if the perpetrator is a family member. So this child must be rescued and ensure that the child continues with the daily activities, such as going to school, and also ensuring that they get psychosocial support, which also is important for us to open a PNC file through courts so that we can get a court order to ensure that the safety of this particular child is ensured. And also in terms of reporting to the police stations, and also ensuring that this child testifies in court. That is where we come as the Department of Children's Services. Thank you.
All right. All right, thank you so much. And I know that whatever we have today, the launch we have today, wouldn't have been possible without the support of our partners. So I would like to move to Ms. Dorothy. You could just speak to us just about the private-public partnership between Vihiga County Government and the partners we have here, and the role they've played to ensure that our GBV survivors get justice, the kind of support you give to them.
Thank you very much. Like I mentioned, I'm representing the collective that brings together different partners, including the CSO Network, Access to Medicines Platform, Twajali Initiative, and the Vihiga Women in Business. And specifically speaking to this issue of GBV prevention and mitigation here in Vihiga County, we as partners have done very many things. Of course, for us, the starting point was the policy, the SGBV policy and child protection policy that we worked really tirelessly. And I think it will not be in order if I do not mention that this work started with our very able Waziri, Onzere. He really ran with this to the point that we have seen this policy to where it is today. And so we have done a lot of work around policy implementation, including budget advocacy to ensure resources are being put in place for these policies to be implemented. We have the hockey clubs in schools, which has been rolled out in 14 schools across all the sub-counties in this county. We have the hockey mashinani forums, and I'm happy that some of the members of that forum are actually on this podium, which is a collective of different stakeholders across all the 25 wards, including the children's officer, the prosecutor's office, the police, youth representative, teachers, healthcare workers, religious leaders, making sure that everybody's voice is on the table in terms of GBV case management and support at community level. Of course, this also includes issues of community sensitization and education, including male engagement, because for a very long time we have left the male out of the conversation. And so in this project, we are deliberately mainstreaming male engagement and male involvement. We have also supported the gender sector working groups, that is making sure that the health and gender departments are actually able to work together and strengthen the different areas they are both responsible for. Of course, SGBV doesn't happen in isolation. It is also domiciled within the reproductive, maternal, newborn, and child health agenda. And so one of the other things we have done is to work closely with the health department to review the RAMCA policy that was actually not fit for purpose because it was really not addressing any of those issues. And we are really hoping that this is one of the policies that will see the light of day before the end of this year. Of course, institutionalizing the referral pathways so that survivors of GBV do not have a hard time in terms of getting justice, in terms of getting the health services that they require. There are many things I can say, but last but not least, we have also supported the sharing of best practices across the 4 counties where we work. That is Vihiga, Kakamega, Homa Bay, and Kisumu County. by bringing together the different teams from these counties to learn from each other and see how to strengthen their internal operations and how to work together at different departments for the good of the people of the county, but also strengthening planning, coordination at sub-county level. Because one of the things we realize is we have a lot of technical working groups, but there is no tool that has existed to allow them to plan based on the indicators and to actually come back and review those indicators to also look at their own performance in terms of how they are performing. So I think in summary, that's what I might be able to say.
Thank you so much. I would also want to share with us, what are some of the achievements you've made since you started this partnership?
The achievements are many. I think one of them is very clear as light today, because for us to see the operationalization of this center today is a culmination of a lot of hard work put together by different partners, which is part and parcel of the SGBV policy that we are referring to. The fact that we have Haki Mashinani forums in 25 wards means we have champions and stakeholders in each ward that we can leverage on to make sure that GBV response and mitigation is actually at the center of what we are doing. And I might add that those Haki Mashinani forums also include ward administrators and chiefs. So we are doing this as a community and as a collective. I think the fact that we are also looking internally at our existing policies so that we make sure those policies are actually serving the people is another plus. And fourthly, the fact that this county is very receptive to partners. You can see we are different partners sitting here today, but all working towards the same purpose. I think is a big kudos to His Excellency the Governor.
All right, thank you so much. I would want to come back to you, Ms. Abigail and Mr. Cosmas. Earlier today, when we were having the presentations from the participants here, an issue came up. We come across cases where you find members of the public, there's always a blame game, you know. Someone would want to be and talk like, you know, the health workers had to blame. That is why I didn't really get the justice that I wanted. Some would want to blame the judiciary, you know, they didn't do their role, and this is why my survivor didn't get that justice. So I would want to know, what is it that you think maybe from your side you're doing that for us we don't understand? That actually we need to understand, we as the local mwananchi, to make your work even more easier.
Thank you. Now, you know, when the courts are operating, they operate as per the law. They just apply the law the way it is. So you could be having a very good case, but unfortunately, if you don't provide whatever is needed, then unfortunately that case will collapse. Now, when you look at like the sexual offenses, when we have to charge somebody with a case to do with defilement, there are three elements that we have to prove. We have to prove the age of that victim, we have to prove penetration, and we have to prove identification. Now, when it comes to age, we expect the parents to bring a birth certificate or a notification of birth. Or if that is not there, we expect age assessment that is always done by the medical officers. That is basically what we can rely on to prove the age. Penetration, we expect the medical officers to come in with the P3s. So the P3 should be there and the medical officer should be able to give evidence to court. Then identification, we expect the victim to confirm this is the person who did that. Now, we've had challenges whereby I might be able to prove the age, I might be able to prove penetration, but the victim denies in court and says, si huyu alinifanyia. That's a collapsed case. And the reason why most of the victims maybe are saying this is because there's that collusion. Aliambiwa na mamake na babake, ukifika kotini, kataa, usiseme sio huyu. So unfortunately, the evidence was so good. The P3 showed there was penetration. But now if the victims comes and says, sio huyu alinifanyia hiki kitendo, that case has collapsed. So most of I would say there are very many dynamics that affect a case, because even as witnesses who have recorded their statements, we expect them to come to court. One thing of taking a person to court is one thing, and another thing of proving the case is another issue. So if all these communities not like trying to cooperate even with the investigators, no matter how the case is good, that case is likely to collapse. So we need, it's a multi, sector agency. Even the communities themselves, they need to come out and be ready to give evidence in court. So basically, those are some of the issues that maybe might touch, where you find that now you might be wondering, why did the judiciary release this person? But unfortunately, it's the law. It says you prove those 3 elements. If one of the elements was not proved, that defilement case has collapsed. As a prosecutor, I have made my effort and took even this person to court. Even at times when we encounter hostile victims, the victims who try to deny, we even step them down and tell the court, give me time. I talk to the victim so that I can see maybe she can change her story. But unfortunately, you try your level best, but she still sticks. That is not the person who did this. So I'm left with my hands tied. So those are some of the challenges we experience.
Okay, thank you. I'll speak on matters of health. We understand sexual gender-based violence and any other violence. We expect the survivors to be in our health facility as immediate as possible, or latest within 72 hours. And what happens within our county, and this is to our people, majorly they come in so that the community can prove that they reported, not because they want justice. Why? They will come in probably 2 weeks after. And remember, you have to get evidence to link with the perpetrator. You have to get the forensics so that you're able to get to the government chemist, so that you're linking the survivor with the perpetrator. But remember, when they come in 2 weeks or 1 month earlier, it becomes very difficult. We will do the PRC form, yes. We will do the P3 form, and we will do the patient notes. Because for us as a healthcare provider, you need 3 things. That is patient's note, PRC form, and the P3 form. We will do, but ensuring that we justify penetration becomes tricky. Getting the forensics to link with this perpetrator becomes a bit tricky. So, and I want to report on majorly between 2022 to 2025. We have reported a high number of cases, but how many come in within 72 hours? Only 50% will come in within 72 hours. And those 50% that will come in within 72 hours, I talked about the package that we give and also the representation. And sometimes our providers get to the court, but the survivor is not in court. And remember, this is a healthcare provider having work to do. He has to come back and serve other clients. So probably 2 mentions, 3 mentions, and there's no survivor appearing, it becomes tricky. But the major challenge is the time they take to ensure that they get to the hospital, so that we are able to get the right linkage, the right forensics, and be able to prevent the pregnancy, whether teenage or not. And we've seen seroconversion. For those who come in, the 50%, we've seen a high number of seroconversion to HIV infection, meaning they missed on the comprehensive package. We've seen again the teenage pregnancy, whereby all the people will tell you until the baby is delivered, then we are able to do the DNA. And yet we could have picked the specimen and done the DNA and linked as early as possible. So those are the few of the challenges. And also people, they wash away evidence. They will come in, but they know what happens. So they'll tell this girl, wash yourself, just to, they know they're protecting the perpetrator. So what are clear, all the evidences and all that, when they come in, and you always say, come the way you are, so that you are taking even the piece of cloth for the forensics. So that is the challenge we have. I think I can speak more and more, but we still have a lot to be done in the community. A lot of advocacy, and a lot of knowing why we need justice, and why that survivor really needs justice, and why that survivor needs a follow-up, because we do a follow-up for the next 6 weeks. But sometimes wanatoroshwa within the community, and we don't know where they end up to. And it becomes so tricky for follow-up. Thank you.
Thank you so much. Those are wonderful insights from the 2 experts. I hope we're taking notes, because now we'll know next time we have such a case, we need to report early. We know what to do, we know who to go to, and what we need to do to ensure that we get justice. We don't get to blame people knowing very well we didn't play our part. Yeah. So I'm going to move to a representative from TISA. I would want you to talk briefly about the services you offer to the GBV survivors in Vihiga County and how you're going to work together with the GBVRC Center to ensure that our survivors also get the justice that they want.
Thank you so much. So as TISA, we had a legal aid clinic in Vihiga County in 2024. From that legal aid clinic, we actually attracted 290 cases. 90% of those cases centered around land cases, succession cases, and the third category of cases were on GBV and children cases. So what that told us from that moment is that there is a need for the community to really get justice or access to justice in regards to GBV and children cases. So then we said it cannot be a one-stop intervention. We need to establish a legal aid center here in Vihiga County, where now victims of such cases can now come and have access to justice. So what we are doing at TISA, we have established a legal aid resource center here in Vihiga County. We have dedicated a legal person to give access to justice, provide the legal aid that is needed to these victims. What we've seen with the victims that are coming in is, and I want to echo what my colleagues are saying here, they come in late. And you hear the case and you know there isn't much you can do, and it's quite unfortunate. And together with that realization, what we are doing now is we are trying to do a lot of community sensitization, telling people, these are some of the steps that you should take for us to protect our children and also to protect anybody who's undergoing this. So first of all, it is important for us to establish the one-stop GBV recovery center in Vihiga County, because there is the risk of what we call secondary victimization. Unarudia the same story to 5 people. And remember, it's a very sensitive story. You even don't want to repeat it. So we really want to echo the county government together with the partners who have ensured that the GBV is a one-stop center for it. And you see, with the access of legal aid upon arrival, because it's what the ODPP is telling us, you have a very clear chance to say if this case is able to collapse or not. And then a documentation of medical evidence is properly aligned with legal standards. So one of the things as we hear the case, we try to ask Umeenda Hospitali, what kind of document do you have? So that to make sure it's aligned if it was to take a legal approach. And most of it's for the survivors to understand their rights and their options. Because at times, these are children. And so the people who come to us are, again, the caregivers. So at times we just tell them, these are your options in terms of the law, and this is what you have to do. Again, I want to echo what my colleagues are saying here. The caregivers are very protective of the perpetrators. So they'll want to tell you, what other option do we have? And I'm like, we don't have any other option. We must pursue the law. So I want to say with the legal aid referral, because it's part of the referral system now, as we talk about strengthening GBV response in the county, is that we hope to reduce the dropouts from the justice system. That is what the legal aid endeavors to do, where survivors often disengage due to confusion or mitigation. Because if people knew there's option, then probably something will be done. Thank you.
All right, thank you so much. We're moving now to Shofko. I would want to commend your job. You're doing a good job in the country. We've seen your work over the years and how you've been working also with the vulnerable communities. I would want you to speak about, now that we're having the center here in Vihiga County, we would want it, maybe what are the lessons that we can borrow from Shofko to implement in Vihiga County to ensure that they they always turn to it as one of the first, the first response that they would want to go to whenever they have this kind of cases.
Sorry, Angeline, just as Shofko is coming on board, I want to believe that is the very last conversation with the panelists. My appeal to the members of the public is kindly prepare your questions. We only have 5 spaces for questions. Immediately she's done, we pick the round of questions, we wrap it up. For those that touch on the leadership, kindly take note of them so that you respond while you'll be making your remarks. Thank you.
Thank you so much, Angeline, and thank you so much, colleagues. We have many years. Different components. One is we need to integrate prevention. We have to focus on prevention. That is the number one thing that we do. And part of the way we do our preventive work is work through the communities. We have a movement of gender champions at the community level that really do door-to-door campaigns, community sensitization sessions, to be able really to ensure that as much awareness is created at the community level so that if there is an issue, then you know where to go. If there is a case, then you know who to refer, where to refer. That then really supports prompt response to issues. And at the same time, the community awareness also creates an opportunity to change gender norms that have not been acceptable. And we can start seeing positive behaviors through the way people are responding, including people reporting, because lack of reporting is because either you do not have information, but the fact that we are doing the prevention sensitization sessions, we are starting to see progressively individuals and community members reporting. And within that, male engagement, as my colleague has said, is quite critical. We live in a patriarchal society. The male have to be involved. They are the shapers of opinions. They are the bearers, the duty bearers at the community level. To ensure that the required evidence, how do you trigger and catalyze speedy response and representation of these cases. So that is still work in progress, but that through that process, then you realize that the people within the system, as has been said, various in handling. The health worker will know if I tamper with the evidence, there will be a problem. The police gender desk person will know if a survivor comes, these are the requirements that I need. In case there are gaps, if in case they've come and they need quick medical support, refer them first to the medical facilities for the health workers to do their work so that they can come with the required evidence so that we can really support the survivor to the end. But other than that, the system, other ways of supporting the system is ensuring infrastructure. A good case in point is that we already have a GBV recovery center here. That is the building. But within that building, to make it operational, you have to make sure everything that is required is there. So how are we doing that as SHOFCO? In areas and in counties where there is no safe house completely, we construct from scratch, ensure it is equipped, ensure that we are working very closely with the counties to ensure that the required human resources are there, the required equipments to support, the required basic services to ensure when you're housing the survivors within that facility, they have comprehensive support in every sense. They are comfortable, even if possible, more comfortable than home. Because these are people who have been traumatized. But in situations like Vihiga, where we already have something, we now are coming in to support the actual operationalization of it. I think we've been informed, the facilities there, partners are coming in, and we're coming in with strength. Different partners are coming with different issues. Some are coming with the capacity building software, others like us are coming to support in equipping. As we understand, within that facility, for it to operationalize, you have to have an operational plan, which can be embedded in that facility strategy. Those are conversations that we are starting to have with Waziri and the Governor's office. But we also have to ensure that facility is equipped. So before you do that, we do needs assessment to understand, okay, this is everything that is required, this is what we can be able to support, and how can we be able now to even start conversations with the county to say, okay, we have this, but this is, you need to make sure that the budgeting issue now comes in, that there is resources in fence to ensure that we can be able to have a facility that is continuous. But the continuous support of ensuring that there is that ownership. This facility is for the people of Vihiga and the communities around community. They need to know that in case there is an issue, then I know there is a place I can be able to call a safe haven. I can be able to have a survivor that can be able to be given the right support, and they can be reintegrated back to the community when there is that readiness. So as that is happening for the survivor, there is work in the community that has to be prepared so that we are creating that enabling environment. So from where we sit, the multi-sectorial approach is critical. Each one of us has a responsibility to ensure we are addressing this issue. Number two, integration is critical. Gender department cannot do it by itself. Security department has to come in. The Children's Services Department has to come in. Health has to come in. We've been told the legal team has to come in. It is a concerted effort for us to be able to ensure that happens. If we can continue with that narrative to ensure the multi-sectorial approach, integration, then that is going to make things easy, and it's also going to attract resources to that direction. Because each department will be ensuring there is a resource, there is funding, there is budget allocation for this, and each one of us together can be able to work together. But communication, media is a critical player in this narrative. We do a lot of gender media campaigns during the 16 days of activism. It's also another platform of really amplifying the learnings, amplifying and ensuring we are educating the communities around GBV issues so that it becomes a collective responsibility, and ensuring that the right information is then communicated to the community with the language, so Angeline, that is your challenge, with the language that is understandable to the community, and talk to the community through issues that really affects them, because this is Vihiga. But trust me, if you go to Kwale or Kilifi, the drivers of GBV could be somewhat similar, but also very different. So communicating to the communities with the language and responding to those specific gender norms that are specific for this community is critical, so that it then makes meaning. I heard the area MCA talking about issues around incest, issues around, the issues that are actually affecting this community. It is, of course, similar to other places, but when you start paying attention, it is more common in certain communities than others. So that is very critical to ensure that integration and ensuring a collective effort to be able to drive the GBV agenda in our communities. Thank you.
Thank you so much. We've had a very constructive conversation here, ladies and gentlemen. We would have loved to even have a whole hour of this debate, but due to time constraints, I know the issues that have been marked out for a conversation. I therefore want to pass over this session to the public, and we are only picking 5 questions in the order of priority. As soon as your hand comes up, we settle on you. Kindly for the panelists, be keen, very keen. That which touches on you, note it down. We shall have the last round of 1 minute on response to what they would have said. Kwa kwanza, acha nikuje kwa Kiswahili sasa. Ninasema kuna maswali. Wa kwanza wapi? Wa pili ndio huyu hapa. Asante. 3 more slots. Watatu, wanne, watano. All of them are ladies. Your Excellency, I told you from the onset. 5. Number 1. Please be audible, straight to the point.
Good afternoon, everyone.
Stand up, please. Yes.
My name is Amorina Ward Mulumbi. I'm a gender champion, and I have this question that I want to ask. Maybe it will go to the national or the commissioner. This is what I want to know. Now that we have a safe space down here, will the county government provide pro bono services to the healthcare providers? Will we be doing our things freely? Because most of the times when we come for the medical services, we always ask for payment. Then I'm asking this, if you are supposed to pay at the hospital, maybe for the SGBVs, are they not allocated, this goes to the judiciary again, are the doctors not allocated their fares when they come to court? Maybe you answer that, then I'll know from there.
Number 2.
Good afternoon, everyone. My name is Phyllis Kadenge. Okay, first of all, I think my question will go to the leadership. I saw there are people who are deployed to the center. On the list, I never saw a counselor, and I know for sexual, assault, if you have been assaulted, you really need counseling. Like after that, it's like grief, you're grieving, you've lost something. So to the county government, are you going to deploy some counselors to the center? I myself am going to volunteer as a counselor because I have a bachelor's degree in counseling at the center. Because I know if these children are coming in, they have issues. Okay, like if you don't give them counseling, they are going to have trauma that will come after in their future life. You will find a girl who boys will be like, huyu ukienda atakupea tu. It is because she was raped and the issue was not addressed to remove the trauma. So she's living with the trauma in life, and now it is an issue to the child, either the boy or the girl. So it's just my appeal to the county government to ask if you're going to deploy counselors, but on my behalf, I've even wrote a letter to the chief office agenda. I'm going to volunteer as a counselor at the GBV center.
Asante. Number 3, pigia makofi.
All protocol observed. I have a question to the ODPP. I really need assistance from you. I have a case from Rwanda sub-county whereby it is being alleged that a certain woman has got a man friend, and this man friend is like the man friend is defiling the daughter. Now, when I got into that case, we did the necessary. We went to the hospital, the doctors examined the survivor, then the survivor, on examination, the survivor proved that she once had a man friend and there was penetration, but with another person who is not the alleged perpetrator. So, this is my question to the ODPP. Under such like circumstances, have you just
not available? As a prosecutor, I'll be objecting and saying, let the matter proceed from where it had reached.
Thank you, Abiga. In a minute, Department of Health.
Okay, thank you. Mine will respond on issues of PRC forms and P3. The law is very clear on matters of defilement and sexual offenses. P3, PRC forms and patients' notes are supposed to be filled for free. And another question was on DPP, if the court gives money to our healthcare providers back, supported to court and also out of court. And also we are in the discussion with the court users committee with the judge to ensure that also our healthcare providers appear virtually, so that again they can be able to spend little, so we can offer also just bundles for ensuring that they attend courts virtually and also to attend to other clients in the hospital. Thank you.
Children's Department.
On matters diversion, it must be minors 18 and below, and the children's officer must file a social inquiry report in court to look at the background of the child, the circumstances under which the child engaged in sex, and therefore recommend looking at both the child, that is the girl and the boy. So it must be minors, and looking at the socioeconomic background and also the parenting. Where is the problem? If the problem is parenting, we look at counseling at family level and also ensure there is supervision. Thank you.
Tisa.
Thank you. I think I'll put mine as a commitment. As we spoke about the multi-agency approach to the GBV Center, I think TISA is already doing this. We are forming a technical working group on this, and we've invited the department to be part of this. Please have this in mind as you come. And to the community, TISA has a legal aid empowerment center at Mbale. Please find out where we are and come find your right options in regards to these issues. Thank you.
Access Medical.
Thank you very much. 3 very quick points. One is just to reiterate the importance of tracking indicators so that we can measure, track, sustain, and accelerate progress. Like somebody said, we must know where we came from. We must be able to measure to see how far we are going. We need to sustain partnerships for sustainability of what has started here today. And we need to consolidate the gains by looking at the One Health approach or the whole person approach. Let's not divide up somebody into many different illnesses and ailments. Let's look at a person as a whole person. Lastly, there's a big correlation between teenage pregnancy and SGBV, and we have a law. Let's use it.
Shofko, finally.
Thank you very much. What next? Translating policy into practice. That's why we're all here. The story began with the GBV policy that was placed, and all of us are coming in to operationalize the same. Next, there is urgent need to ensure that we have an operational plan for the safe house so that we can be able really to come in and contribute. Partnership coordination is critical. I think we've talked about a multi-sectorial approach, or coming together as different sectors into this. My commitment, our commitment as Shofco, is that we are in this together. We will work with the Vihiga County government to ensure we can be able to do everything possible around these issues. Lastly, I would encourage the county really to be very strategic in ensuring there is deliberate ring fencing of budgets to ensure that operationalization of the facility and the work that will already begin to ensure this facility is actually taken over and survivors are walking into that, then we have resources that will ensure there's that continuity. And lastly, it is our collective responsibility. It is not for one person. It's not only for Vihiga County. It's not the governor's problem. It is not Madam Ruth's problem. It is all of us, all the way from the lowest level community level to the highest policy level. So let us come together to really fight against GBV. Thank you.
Thank you. Concluding remark from Angeline, our moderator.
Thank you so much, and we appreciate your presence here. It's been a very good session, and I've also been challenged here, my role as a journalist. So I want to come back here maybe the next few months or a year and see whatever have the kind of development we're actually experiencing with the new facility. I would want to come here and cover a story of hope, a story of change from the survivors. Yeah, thank you.
Thank you so much, ladies and gentlemen. Let's give them a round of applause as they get off the stage. Asanteni sana, very brilliant guys. The OTBP guy has not let us down, Your Excellency. Right from our measure in the onset, he has spoken out quite very well. Allow me, Your Excellency, therefore, to bring in the Chief Officer to respond to an issue touching on the volunteer, then bring in Waziri to proceed with the program. Asante sana.
Thank you so much, Director and the panelists, for the great job you've done. Time is not on our side. I want to assure the lady who has done counseling psychology and who has written to the department to be a volunteer will act. You'll come and work with us as a volunteer. You are most welcomed. Allow me to bring in Waziri so that we can continue with the program. Our enforcement.
Thank you so much. So time will move very fast, and I would like at this moment thank you so much. At this moment, I would like to invite the County Commissioner to give her remarks and even welcome us to Vihiga.
Thank you so much, Madam Ruth. To His Excellency, our Governor, Mheshimiwa Deputy Governor, CEC members wote, naona MCS wameenda, heads of department na wananchi. Hamjambo. Good afternoon. Good afternoon again. Your Excellency, we were having challenges today. We were supposed to be here with the full security team, but one of us retired yesterday because of the mandatory age, and there was handing over. We communicated with the incoming county police commander to join us, but he's still taking over the station. I just want to say some few remarks. And before the few remarks, all heads of department, national heads of department, gender desk police, kindly just stand and wave. We are among those people that are so much impressed with the GBV Center. And I want to say this because in the justice system, you will find that it is full of the national government. And that is why we have the largest blame that goes to the national government, starting with the chiefs. Because we are the first contact person where the justice system starts. But I want to say that we have a difference in the GBV Center. This is all about us. It is not about the county government. It is not about the national government. It is all of us, the community, partners, leaders, political leaders. It is all about the governor, the county commissioner. We cannot work in isolation. We have the challenges, the gaps that we have had the community members highlight on. And I want to retaliate by saying, with the GBV Center, it is all about the holistic approach in issues or matters GBV. And GBV is so wide. We keep on talking about assault, wife beating, defilement, rape. It is so wide. It is so wide, including even those ones that have consented. But one is spreading an STI to the other. All that is GBV. So it is so wide, complicated, emotive, and it has so many challenges in handling it. If we are not a team, we may not be able to succeed. And I want to tell you that from designing on the operations of the center, from designing, it must be people-centered, community-centered. It must be giving feedback and solution to the needs of the community. And that is why the government came up with an approach of having the GBV centers within every county to come up with a solution that is homegrown. Number two, that it is not about competition, who is doing it well. It is about all of us coming together, identifying the challenges, the gaps, and coming up with holistic solutions that are able to solve our challenges. Finally, I will want to say that we all matter in mapping out the partners. And having partners walking the journey together gives us a leeway in having proper solution. We should not name call each other. It is not about the police. It is about us. If we own up that yes, we have this problem, we will have solutions as a team. And building a team, His Excellency, is not easy. Building a team will not be easy. You can imagine people who are used to working independently, keeping them in one room to work as a team. It is not easy. And therefore, we will have the challenges. We will do social audits. We will do monitoring and evaluation. Where we have failed, we go back to the drawing board as a team and we move forward. We will not surrender as we move as a team to ensure that our people are living in a secure environment. And to our partners, Betty, this is a request that we have models of GBVs centers elsewhere. They are in Mombasa, we have them in Kisumu, we have in Nairobi. Kindly, before this team embark on real operationalization of the GBV center, can we have a team going for benchmarking so that when we come back, we are able to implement exactly than doing an error and going back to the drawing board. We need to learn. I know I've worked with Shofco in Mombasa. In Mombasa, we did our best. I know it has tested the waters for over 10 years. Can we go back and learn on the best so that we don't start it as newcomers on board? We come in as people who have gone to benchmark from the best and we come and implement. Otherwise, we want to appreciate, we have our new county police commander that has just joined me because I requested that he comes. Kindly come and introduce yourself. I also don't know his name, but I just know he's our new county police commander.
Thank you so much, County Commissioner. Our Governor, His Excellency Sir, all protocols of staff, ladies and gentlemen, good afternoon. My name is Mr. Daniel Chirchir. I'm the incoming County Police Commander Vihiga. I was based in Dadaab, UNHCR camps. Yes. Otherwise, we will keep on knowing each other as time goes by. Thank you so much.
Thank you. Thank you, County Police Commander. We work as a team in Vihiga. And that is why I told you, without the formal introduction, let us have the informal introduction so that we team up from today to work. And lastly, we have all the expertise. We have all the expertise from the national government to the county government. Let us bring the expertise on board so that we work as a team. Funding will come later. Let us utilize the available resources to ensure that we operationalize the center. Other things will come later. Gari, Nini, the available resources that we have, we will use them to ensure that we have a flow of services within the center. And for the expertise that we have, we utilize it maximally. maximally. Otherwise, thank you so much. Thank you, Madam Waziri, for being a team.
Thank you. Thank you, Madam Commissioner. A clap for County Commissioner. Thank you. And at this moment, kindly allow me to invite Mr. Mohamed Jafar, who is the Project Manager, UNDP Kenya.
Thank you very much, Waziri. Abana bafe Murembe Khani. Inzivananga Mohamed Jafar. Right? Lakini imeishia hapo. So I'm going to continue with my classes later. Your Excellency, the Governor, Vihiga County, the Deputy, the coincidence of names, that's Wilbur and Wilberforce, is indeed a force that we are all acknowledging and really appreciate and happy to actually see that kazi inafanywa. County Commissioner, the colleagues and friends from the national government, Bwana Police Commander, they say new brooms sweep clean. You've come at the right time where people are talking about the challenges that they run into when they are following up cases specifically on GBV. Bwana County Governor, it really warms our hearts when we see that there's a deliberate planning and budgeting. When the MCA was speaking here, he mentioned that in the ADP, specifically, incest and a lot of these GBV-related problems have been highlighted. So the deliberateness of the kind of work that you're targeting to do in this county is one of those things that, for example, at UNDP, we are really honored to kind of work on and support. We are in a very challenging situation where quite a lot of the funds are dwindling. It's a double-edged sword in the sense that we are now being referred to as a middle-income economy, meaning that we not only have policies, practices, but also empowered communities that are basically going to hold our governments to account to make sure that whatever collections we make as a country can ensure that the safety nets that have been set or put in place, especially to fight GBV, are being utilized. We have agencies like TISA, SHOFCO, and quite a lot of other organizations basically that are accountability structured or in their DNA basically. Those are the strengths that as UNDP we are very privileged to work with, of course with the funding of my brother Dr. Johnston Kuya from the Netherlands Embassy. I come from a community that says maneno mengi hayajazi bilauri. I don't want to be mwingi wa maneno, but example moja to Governor, if you'll allow me. And I'm really happy and privileged, especially in Vihiga, because Governor, when we had the discussion in the morning, I was telling you the level of empowerment of the community to speak about GBV openly is a very big step. There's an example in my community, kuna jamaa ambaye aliumia mguu, akaenda daktari, alafu akaona mimi ni mjanja kuliko daktari. Instead of telling him it's a right leg that is aching, wacha nimwambie ni left inauma. So they ended up amputating the good leg, but the bad leg bado haijapata dawa. Right? But the people in Vihiga, wamesema mguu inauma ni hii. Kama njia tutaikata ama tutaitibu ama vile tutajaribu solution as a community, as a county commissioner says, the teamwork we are seeing in Vihiga County is very heartwarming again. Because in other agencies or other counties, we have people, kila mtu anafanya kazi yake. Huyu amekimbia kule, SHOFCO, UNDP, CSO network, and quite a lot of the civil society organizations here, we are coming up as a formidable team to make sure that as the non-state agencies, we are working very closely with the county to make sure that at least kutoka upande huo, we are supporting you. Na wanasema whoever pays the piper calls the tune. I'm privileged to speak before that who's paying the piper. And the tune that that particular agency has been working around is assisting us to fight GBV. Yeah, because it just transforms, we have what we call the hydra head that has multiple heads. Unakata hii kichwa moja, nyingine inamea. But again, we will not tire kuendelea kata hiyo kichwa, na kichwa hapa ikiendelea kumea pia. Tutafanya kazi kwa pamoja wote to ensure that at least we are getting rid of that problem. Now allow me to come to the GBV Center. Colleagues, friends, partners, Your Excellency, the fact that we've set up a GBV Center in itself speaks volumes in terms of how, as a community, we are working towards making sure that we are taking care of the vulnerable in our community. But Madam, I think it's Jael and Tim. The fact that you guys are hosting or been doing this work of following up these vulnerable communities, even before the setting up of this GBV Center, talks to the commitment we have as a community to make sure that we are not going to get people from outside to come and help us solve our problems. Brothers and sisters, colleagues, mabibi na mabwana, tuko hapa pamoja. We undertake to continue walking and stepping in the same solution-driven mind. Bwana Governor, allow me to stop hapa. Nisiwe mwingi wa maneno, lakini let's gauge each other in terms of the actions that are going to follow this. Kwa haya machache, kama nimekosea, naomba kusamehewa, na kama nimefanya vizuri, naomba makofi kidogo tu.
Asante sana. Makofi tena kwa Bwana Mohamed. Asante. And now, Your Excellency, I would like to usher in Dr. Johnston Kuya, who is the Senior Policy Officer, Strategic Partnerships at the Embassy of the Kingdom of Netherlands. Karibu sana, Johnston.
Thank you so much, Waziri. Your Excellency, Governor, Deputy Governor, County Commissioner, and our new police commander, community leaders, ladies and gentlemen, good afternoon. Murembe mwesi. I know it's a surprise, but I have to say it because I'm proud also to be, they say, a son of this great county, right? Yes, I'm privileged to be here today, also in my capacity, also as a community member from this area. And of course, I work at the Netherlands Embassy, and we also have a history with the governor. I think the governor, for those who do not know, during his early days in career, he also studied and lived in Netherlands for, I think, more than 6 years. So there is a close connection. So we are happy that the Dutch government is also collaborating and supporting this initiative. I know so many people have given remarks, and of course, Mohammed, with such a speech, I don't know what you expect me to say, but I'll check 1 or 2 points. It's a digital world, so nowadays we work with our phones. Gen Zs in the house, I know they are very familiar with this. I think for me, 2 things. We really appreciate the leadership of the county for ensuring that this center is open. And of course, it's going to do great things, but it's also going to restore lives. And that is something we are very proud of, and we are looking forward to support the governor on that. The other thing I've noted, of course, Jeff has also mentioned, is about this issue is not going to be a private issue anymore. I think it's going to be a public crisis that all of us will need to talk about every day. So for me, it's just to encourage men and women, young boys, all the leaders, everyone, because this is an issue that all of us will need to address. And the Dutch government is here to support and show its solidarity through our partners who have done amazing work now and will continue. So I don't want to give so many remarks. I know we are waiting for a speech from the governor. And for me, please receive greetings from the ambassador of the Kingdom of Netherlands in Kenya, Ambassador Henkian, who was not able to be here today. But we are here to represent him. Yeah, so. Asante.
Thank you so much, Mr. Kuya. Another clap for Mr. Kuya. Thank you. At this moment, Your Excellency, I would like to bring in Pamela, who is going to speak on behalf of the Mama County. Remember, Mama County is the one who actually constructed the GBV Center. So, Pamela, karibu.
Thank you so much, Waziri. Your Excellency, the Governor of Vihiga County, the County Commissioner. Let me ride on the already set protocol. Ningependa kuwasalimia nyote. Mlembe mbosi. Bwana Yesu asifiwe. Asanti sana. Kwa niaba ya Mama County Honorable Beatrice Adagala, I wish to say that this is a very delightful moment for us in the National Government Affirmative Action Fund and the Office of the Women Rep. It was a dream that we looked at and we thought is not coming to actualize, but as at now, I'm now seeing the light at the end of the tunnel, and I know that where we stand now, and with all these partners I'm seeing, I'm sure Vihiga is in a safe pair of hands. Congratulations, Bwana Gavana, kazi njema. Nitaambia Mama County, I went, I saw, and I believe it is going to take off. Therefore, on behalf of Mama County, nasema asanteni sana wananchi wetu na hasa jamii hapa Vokoli. Those people, the moment the county government gave us the piece of land, there was a building there. But that building had been vandalized. Madishi ilikuwa imetolewa, milangi imetolewa na kadhalika. But the building that was constructed by NGAF with the patronage of Mama County has remained intact because we talked to the community and told them the importance of that building there. They have taken care of it. There's a young man in the name of Robinson. Sijui kama ako hapa. Yule ambaye amechukua kama ni boma lake. He's taking care of that place. And I'm glad that as we now bring on board the staff, I believe Robinson will not be left behind because he has taken care of that facility right from inception up to here. So that Kalimandu bebo koli, banolendi mwana bebo koli kandi yakonola figasi ya enera. Sima bebo rahimba. Thank you so much. I think I'll take to Mama County very good message that hata Netherlands ilikuwa, hata Shofko ikawa, hata sijui nani akawa, na above all, Governor alikuwa. Bwana Yesu asifiwe. Thank you so much. Minembe ja Adagara. Minembe ja Mama County. Asante, you want to see it move. And Waziri, hawa mama unaona hawa? Hawa mama hawa? We should never underrate them. Hawa mama wakati CS Shebesh alikuja, wao ndio walienda naye kwa room and they talked to her. When CS Shebesh by then, CAS, left the room, she said, I've seen everything that is to be seen about GBV in Vihiga, and therefore the building has to go on because it had stalled. That has to go on and should be operationalized. Thank you so much, the HRDs, the human rights defenders. Thank you so much, the survivors. You've worked with us, and I know you'll keep on working with the county government. Nasa abagasi zibos. Asante.
Asante sana.
Patia nini? Sasa lips gani? Mimi. Nyinyi mmeweka kamera zote zimeangalia kwa mtu mmoja.
Haya iko inafanya. Sasa si ndio hiyo bado. Sasa ni
Your Excellency, Paul, you know when you are leading us as the head of the county, the people, the attendants wanastahili kusimama kwa sababu yako, lakini tutatengeneza hiyo na waziri rudi. It is only all of us stand because we are under His Excellency the Governor. So Deputy Governor huwa asababishi Governor anasimama, ama penye Governor yuko kiongozi ni mmoja. Your Excellency, the Governor, together with the County Commissioner, our partners, washirika wetu wakuu, wakilishi wa the United Nations Development Program UNDP, our brother Kuya akiwakilisha ubalozi wa Uholanzi, Netherlands or Dutch, our partners in SHOFCO, the Civil Society Organization Network, wote ambao tumefika hapa siku ya leo. Your Excellency, nimekuja kujumuika pamoja na wewe kwa sababu ya lengo kuu ya siku ya leo ya kuweka kwa matumizi our Vihiga County Sexual and Gender-Based Violence Rescue and Recovery Center. Your Excellency, let me join Waziri kuweka heko na hongera kwako. Every good thing that is development in this county inafanyika kwa sababu tuko na governor yule ambaye ako na maono ya kubadilisha mtazamo wa maendeleo, na nishukuru tena mwakilishi wa Mama County kwa sababu bila ushirikiano wa Mama County na governor wetu hatungelikuwa hapa siku ya leo kwa kuweka kwa matumizi ya our SGBV center. So congratulations Your Excellency, congratulations Mama County. Your Excellency, wakati tunajumuika hapa utuongoze kwa kuweka matumizi to GBV center. Mambo ya SGBV katika taifa letu la Kenya, tumepata kuona ya kwamba Rais wa Kenya vile vile ameyatilia mkazo, the President of the Republic of Kenya. So Governor, wewe vile vile mkiwa pamoja na Mama County ni hatua nzuri sana, so that county yetu ya Vihiga isiwachwe nyuma kwa kuzingatia na kuweza kumaliza matatizo ambayo yanapatikana kwa sababu ya dhuluma za kijinsia. Your Excellency, nimefanya utafiti wangu kidogo na nimepata kujulisha kwamba this center yenye umeweka kwa matumizi siku ya leo, in the Lake Region Economic Block, we only have a safe home in Kisumu. So Vihiga County becomes the second county in the Lake Region Economic Block ambayo tena itakuwa na center ya kushughulikia masuala haya. Najulisho ya kwamba SHOFCO vile vile wanasaidia county ya Homa Bay. So Homa Bay will become the third county kukuwa na center kama hii katika Lake Region Economic Block. Our county women representatives wakiongozwa na mama wetu Beatrice Adagala katika Kenya nzima wanazidi kuongoza injili ya kujaribu kutatua matatizo ya GBV katika taifa letu la Kenya. Na kwa hivyo matarajio ya wale ambao wamejumuika hapa siku ya leo, waziri pamoja na idara yako, ni kuhakikisha kwamba center hii itafanya kazi vile tumejitolea ili iweze kukua na iweze kutimiza malengo muhimu ya kukua nayo katika sehemu yetu ya hapa. Nihimize tu ya kwamba wakati tumeona the panel discussion ambayo imekuwa hapa, mwakilishi wa judiciary ameweza kujieleza, mwakilishi wa county ameweza kujieleza na mashirika mengine. Sasa ni wazi kwa sisi sote hapa na kwa watu wetu wa county ya Vihiga ya kwamba mambo hii inahitaji kila mmoja wetu kuwajibika. Tuchukue hatua muhimu ili tuweze kumaliza kwa sababu mambo ya GBV inazuia maisha ya watu wetu isiweze kuendelea mbele vizuri. Kama ni watoto wale wetu malaika, inatiza msingi wa elimu na msingi wa maisha yao iweze kutoka katika barabara. Tuweze kurekebisha hiyo kwa sababu ni wajibu wetu kwa ujumla. The national government
county government tutafanikiwa tu kwa sababu lazima tupeleke hii elimu na tuhamasishe, hata kama ni katika shule zetu, tutilie mkazo ya kufikia hapo katika msingi muhimu ya kusaidia kwamba jamii isitoke kwa barabara kwa hii mambo ya SGBV kwa jumla. So asanteni sana, nafikiria kwa sababu ya sana wakati wengi wenyu mnasikia mnangojea kwa hamu na gamu kusikia kutoka kwa gavana wetu, kwa sababu ni yeye na mheshimiwa mama county wetu Beatrice Adagala ambao walikubaliana ya kwamba lazima hii center iweze kufanya kazi. Gavana akapatiana rasilimali ya shamba, mama county akawekeza katika kujenga hiyo center, na sasa gavana ataiendeleza mbele ili iweze kufanya ile kazi ambayo inatarajiwa, so that it is able to serve purpose. So kwa hayo mafupi, let me request all of us, wacha niulize sote, hata bila kusimama, mnaweza mkaweka mikono yenu pamoja, mjumuike na mimi tafadhali, kwa heshima, kwa shangwe, nderemo na vigelegele, tuweze kupata kukaribisha tu aweze kusema, kunena na sisi kwa siku hii muhimu ambayo anazindua na anawezesha center yetu kuweza kupata kufanya kazi. So let's put our hands together. Tafadhali tuweke mikono yetu pamoja, nipate munisaidie tafadhali, tukaribishe gavana wetu. Karibu sana Your Excellency.
Basi tuketi. To me, this is a special day. It's a special day when we are achieving our vision, which has been on the drawing board for the last 8 years. So I'm a very happy person, because in my manifesto, when I became the governor of this county, one of my agenda was to deal with issues to do with the gender violence, because it was so rampant and it still remains rampant. And I committed myself that I will work with all the stakeholders to ensure that we deal with this menace, and we also construct a rescue center where victims can have a rest or a respite while we find a solution for them. I want to thank our Women County representative, Honorable Beatrice Adagala, because she came to my office and requested that we work together to put up a center. And I agreed to give a public land for that function, and she agreed to provide funding to build the structures or buildings for the center. She did her part, and in 2023, those of you who remember, in this same ground, the county government was handed over the building to finalize and operationalize. It's taken some time for us to operationalize. But as a government, we wanted to put structures in place. And in government, you need to have a policy and you need to have a law to do that. So the first thing we had to do is to come up with a policy. So I want to thank our government partners for supporting us to come up with gender-based violence policy, which we concluded last year and also commissioned. We are at advanced level of now formulating a gender-based violence bill, which will now set up a law in the government on how to deal with the gender-based violence as we move forward. I'm already aware quite a number of development partners, including Netherlands, SHOFCO, UNDP, and the rest, will be supporting us in finalizing the gender-based violence bill, which then will be enacted into law. So I want to thank the development partners for the effort you have done. We also, as a government, wanted to improve the structures because we realized the structures we had got from the Mama County were not adequate. We started construction of a dining hall, but unfortunately, due to financial constraints, we have not completed that hall. But I want to commit that we have already put money in the budget, and as we operationalize this center, we are equally going to ensure that that hall is completed so that it can be used. We are also going to put other structures there. So we are committed to ensure that the center becomes fully operational. I want to thank all the stakeholders who have worked with us. The national government, through the county commissioner, we have worked together. Our development partners, we have worked together. And all other key stakeholders. And particularly, I want to recognize some of our members of this society who found it necessary to do something while the government was still dragging its feet. And I want to honor the ladies who are here, who took to themselves to set up rescue centers to ensure that those who are aggrieved can have a safe home. And particularly, I want to thank Jael. I think you need to stand so that we know. That is a great lady. And that's why I had even to give her a medal. You can see her medal in her neck, because she has done a good job. I had a chance to go to her home and see what it's doing, and I was impressed. I also want to thank the rest. We are also going to honor you so that we recognize what you have done. Because it's important to recognize what our people are doing. You don't need to be a governor to be recognized. There are people who are doing great job in this community, but we are not recognizing them. I want to assure you that we are with you, and as we open this center, we are going to work with you. So we are not saying that now we have opened this center, now those of you who have been working tirelessly, we are going to leave you out. We shall partner together and work together. So I want to assure you that. We have organized how to run this center, and you have seen from my department led by the CEC in charge, Dr. Ruth Agesa, we have planned well. We already seconded people who run the center. We have already secured assurance from our development partners, and you can see all of them are here, are ready to work with us. But for sustainability, because our development partners are not going to be with us forever, for our sustainability, we have agreed as a government, we are going to create a budget for this center. We'll have a budget that will be able to be used to run this center. I've already talked to the MCS who are here, particularly the women reps, and we have agreed that in the next, I won't wait until June next year. We have agreed that in the next supplementary, which we are going to do next month, we will have to budget money for this center. So I want to assure you that the center, as we are supported by the development partners, we are also going to put in money to ensure that the center works. The development partners are also going to help us put together regulations, because we must manage this center with a particular mwongozo or regulations. So I want to really agree with our county commissioner that the team that is going to manage this center must be taken out to visit a center that has been working or it continues to work for benchmarking, so that they know how centers of this nature are managed. So I hope I'll talk with our development partners and even ourselves as a government to ensure that we choose one of the areas, whether it's the one in Ilikoni or any other place, so that we can take our team there to do benchmarking. I want to agree na wale wote ambao wamezungumza hapo mbeleni. This issue of sex and gender-based violence is a national issue and is also a community issue, and is an issue that involves everybody. Everybody. Everybody must be responsible and must be concerned about this menace or pandemic. And particularly here in Vihiga. Vihiga, we are among the first 3 leading counties in the country in the gender-based violence cases. So as a county, we are not doing well, and I'm not very proud. We are doing very bad. And therefore, it's our responsibility as we commission this center to go on the drawing board and find out where is the problem. Because we need to prevent this menace. We have to find how to prevent rather than cure. Because mumesikia hapa, and that's the biggest problem. Hii makesi ikienda kwa court, yale ambayo natarajiwa iwepo ama evidence, ndio ule ambao amefanya hiyo maneno mbaya adhibiwe. You have seen it's very difficult. Hata nilikuwa nauliza hapa maneno mengi, niliuliza county commissioner hapa, hivi vitu vingine wanasema itapatikana namna gani? Kama alisema we must confirm there was penetration, utaconfirm namna gani? Na hii maneno kama imefanyika, maneno imeisha. So we need to prevent. Na vile mmesikia hapa, watu wetu wengi hawataki kwenda kotini kutoa evidence. Hawataki, na baadaye wana compromise wale waadhiriwa, so that waadhiriwa wakienda kotini pia wanasema haikufanyika vile imesemekana. Therefore it becomes a very complex matter. So the best is we work out on how to prevent this. Now, to prevent this, we must go down to the community and talk to the people and consistently keep on talking to them. I have liked the model Shofko have talked about here, we must engage the people at the county level. Na hii kwa vile ni sisi zote, hata watu wa kanisa, tuko hapa kwa ground ya kanisa. You must help us. The provincial administration, ama machiefs ngao, we must work together. Sasa niko na timu mzuri sana ya ward administrators. Mmewaona hapa, vijana chupukise kabisa. And I've empowered them, I want them to work. So commissioner, mimi nataka machiefs wako na ward administrators wangu wafanye kazi pamoja. They have information reporting every month or every week, wawe na report what is going on. Na eventually, kulingana na hizo report, we want to map. Tunataka kumap areas sa hii county ambazo ziko na hii janga la gender based violence, ambao incidences ni nyingi. So I'm ready. We have teknolojia ambao tuko nayo. We want to map everywhere. Na hata wale watu ambao our chiefs and our ward administrators, muko on the ground, munaweza jua familia ama mtu ambao ako prone kufanya hiyo maneno. So hata wale watu ambao wanashukiwa, we need to know them so that we can be able to monitor them. So ningependa tufanye kazi pamoja, and I want to assure you that as a county government with all the stakeholders, hili jambo lazima tupate jawabu lake na tuhakikishe kwamba hii visa vinapungua kabisa. My vision is in the next 5, 10 years or even less, we should close that center. Kwa vile hatutakuwa na visa, kama kila kitu tunafanya vizuri, hatutakuwa na haja ya kuwa na center, we close it. So let us work as a team. Gender-based violence in Vihiga hasa inasababishwa na unywaji wa pombe. Unywaji wa pombe na bangi, ufutaji wa bangi na ile madawa ingine. So as a county government and a national government, I want us to work together as we agreed when the Minister for Interior was here 3 weeks ago. Tufanye kazi pamoja na nakada, ili tuhakikishe kwamba hii janga la pombe, unywaji wa pombe hasa chang'aa, na ufutaji wa bangi na hawa madawa ingine, we must work together tuhakikishe kwamba tunamaliza haya madawa. Na wale ambao watu wanauza pombe hiyo ya chang'aa, komanda umeingia hapa, sijui ndio ako hapa. Yeah. Komanda, ile janga umekuja siku mzuri, na umekuja wakati tunazungumzia jambo ambalo linatukera sana hapa. Ni unywaji wa pombe wa chang'aa na hiyo madawa ingine. Na tuko na vituo ambayo inajulikana inauza pombe, lakini hiyo vituo inaendelea kufanya kazi. Nasikia zingine ni toll stations, police station wanapitia hapo, chifu anapitia hapo, alafu mtu ingine anapitia hapo. So hakuna chochote nafanyika. So commander, wewe as you come today na umesema unotoka Dadaab. Dadaab ni mahali ambao watu lazima ufuate sheria. Sasa wewe kitu ya kwanza ukuje hii vituo ya chang'aa funga. Na hii na wewe county commissioner, hii machifu wako ambao wanakuwa toll station wanapitia hapa asubuhi, deal with them. Because tusipodili na chang'aa na pombe ya chang'aa na bangi na hii madawa ingine, hii vitu ya violence haitaisha. So let us take together. Maofisa wangu wa ward administrators pia, mimi nataka muwe na niripotia wale ambao wanauza pombe, wale wanauza bangi na hawa wote, kwa ripoti zenu za kila mwezi muniletee. Lakini mahali ambao maneno ni mbaya, tumeni habari haraka. We will work together with the county commissioner kuhakikisha kwamba tunadili na hawa. So kwa hayo mengi sitaki kuendelea kushinda hapo, lakini nataka kusema watu wa Vihiga tufanye kazi pamoja, tuhakikishe kwamba hili janga la sex and gender based violence tutoke kwa hii, tuwe watu ambao wanaishi vizuri. Kwa hayo mengi nasema asante sana na mbarikiwe. Naona vijana wangu hapo wamekuwa watulivu sana, nasema asante. Naona vijana hapo wamekuwa watulivu, kila nyinyi wote mmekuwa watulivu. So mimi nikienda kufungua hiyo center, wale vijana wangu na wale wengine hapo mubaki hapa tu, mtapata salamu kidogo. Asanteni sana.
Asante. Wapi makofi ya gavana tafadhali? Your Excellency, naomba uketi tuwapatie namba yetu ya toll free, ili toll free
namba ambayo tuko nayo kwa serikali ya kaunti ya Vihiga. Hivi visa tunataka kushirikiana na idara yetu ya masuala ya jinsia kwa jamii, unapiga. Haya, tuko tayari? 008 00
Sasa, it is my great pleasure to officially commission this center.
Asante sana. Basi tutaelekea kule aweze kuunveil the plaque, na ninaomba tuweze kusoma. NDP songa pale, karibu county, karibu pata deputy governor, makofi pia. Gari amepata nafasi muhimu. Tungependa Your Excellency uweze kusoma maandishi ambayo yako hapo.
Basi maandishi plate ni Vihiga County Gender-Based Violence Recovery Center was officially opened by His Excellency Dr. Wilbur Silva Otichilo, EGH, the Governor, Vihiga County, on Tuesday, 30th September 2025.
Asante. Makofi kabisa. Asante sana Your Excellency.
Hii plate pia inaonyesha wale partners wetu ambao tumeshirikiana. Naonyesha Netherlands, Shofco, Amgeni na UNDP.
Asante kabisa. Basi kwa wakati huu ningependa kwa ishara kubwa kabisa His Excellency apate nafasi ya kufungua kirasmi jengo hilo. Ishara tu basi iko tayari, imefunguliwa kirasmi. Asante. Makofi kwa governor. Thank you so much. Asante. Tukielekea kule ndani, Your Excellency utapata nafasi muhimu ya kuweza kusign kwa mara ya kwanza pamoja na partners wetu. Tukielekea sehemu ya baada ya hapo, utapata nafasi ya kutembelea jengo hili rasmi, kujua tu ni lipi ambalo liko hapa. Excellency amepata nafasi huu. Excellency amepata nafasi. Hii tutatumia kwa headquarters. Kuja kwa headquarters. His Excellency Governor bado anashukuru ambao wamekuwa usaidizi mkubwa na pia wametoa commitment tukiongozwa na waziri afisa wetu daktari afisa wa kushughulikia mambo kadha wa kadha katika sekta, tukiongozwa na chief guest wa siku ya leo, Excellency Governor